August 31st, 2020 electronic meeting of the City Council. We're meeting electronically due to the COVID-19 coronavirus pandemic in accordance with the Governor Sununu's Emergency Order Number 12, pursuant to Executive Order 2020-04. Please note that in accordance with the Governor's Emergency Order, we have provided public notice of the necessary information for accessing this meeting. Instructions are provided on our agenda on the City of Concord's website at concordnh.legstar.com/calendar.aspx. We are utilizing the Zoom platform for this electronic meeting. All members of the City Council have the ability to communicate contemporaneously during this meeting, and the public has access to listen and, if necessary, participate in this meeting through clicking on the following website address: us02web.zoom.us/j/831-757-28546. If any member of the public does not have a website access, they may dial telephone number 1-929-205-6099. If dialing from a landline, you may call toll-free at 877-853-5257. The webinar number is 831-7572-8546. For those of you who want to provide public testimony in the public hearing portion of this meeting, you are connected to the Zoom website. You may click on the raised hand icon in the attendees section to make the request. When the time is appropriate, you'll be recognized by me and you can provide your testimony. For members of the public who are participating by phone, you may dial *9 to alert me that you want to testify. We will not be using the chat function in the Zoom for this meeting. Please note that testimony is only allowed for agenda items that have been scheduled for this public hearing, and public participation is not authorized for any other item on the agenda. If anyone has a problem accessing the meeting, please call 603-230-4619 or send an email to citycouncilmeeting@concordnh.gov. In the event the public is unable to access the meeting, we will adjourn the meeting and have it rescheduled at that time. Please note that all votes are taken during this meeting shall be done by roll call vote. Let's start the meeting by taking roll call attendance. When you state your presence at the meeting, please also state whether there's anyone with you in the room during this meeting, which is required under the Right to Know law. Madam Clerk, please call the roll.
Councilor Bouchard.
I'm here, I'm home, and I'm alone.
Mayor Boulay.
Present in my office, alone.
Councilor Champlin.
I am present. I am in a room in my house. My wife, Susan, and my daughter, Madeline, are in the house as well.
Councilor Fennessy.
I am here. I am in a room at my house by myself, and I'm hoping to join via my computer once it starts working.
Councilor Grady Sexton.
I am present. I am alone in a room in my home.
Councilor Hatfield.
I'm present. I am in Hardwick, Vermont, and I am by myself.
Councilor Keach.
I am present, home, alone.
Councilor Keniston.
Here, home, alone.
Councilor Kretovic.
I'm here in a room by myself. My husband is within earshot. He's not listening.
Councilor Matson.
I'm here in my home, alone.
Councilor Nyan.
Present, Council Chambers with City Manager and Deputy City Managers Bahia and LeBron.
Councilor Pierce.
Present, I am home, alone.
Councilor Rice Hawkins.
Present, at home, alone in this room.
Councilor Todd.
Here, home, alone in this room.
And Councilor Werner.
I'm here, alone in this room.
Thank you very much. Before we get to the public hearings, there is 2 comments on the question and answer piece, although we're not using it, by Kit DeVries. And I just wanted to say that the question was, what's the telephone number and how do I gain access to the screen? I can see, Kit, I can see you in the attendees section, along with 85 other people. And your hand, if you wish to testify, as I stated earlier, just raise your hand and we'll go down the list and I'll recognize those people who raise their hands. So I do recognize you and notice you're there, so we'll get to you soon. Just a reminder for the public, if you are having question or trouble accessing the meeting, please call 603-230-4619. Again, that's 230-4619 if you're having any trouble accessing the meeting. Or you can send an email to citycouncilmeeting@concordnh.gov. Reminder for the counselors, please mute yourself when you're not speaking. Please click on the raised hand icon in the participant section in your Zoom screen. And with that, I think that gets us through all the technical things. So, Madam Clerk, if you could read item 3A, please.
It's an ordinance amending the Code of Ordinances, Title I General Code, Chapter 13, Public Health, Article 13-4, Vaccines and Communicable Disease, by adding a new section, 13-4-14, entitled The Wearing of Face Coverings in the City of Concord COVID-19.
Thank you very much. Before I recognize the city solicitor, I just wanted to say a few things. First is that if you are listening and you sent in an email or any other kind of communication, then the city clerk has distributed that to all of the counselors. So if you are somebody who's listening and wishes to testify and you already have said something in, just keep in mind that we already have, we've seen your comments already, and we thank you for those people who sent those in. I will also say that everyone should have received, and it was publicly noticed earlier today, the city solicitor with a revised ordinance. So I thought that it'd be, unless Mr. Manager, you have some comments first, I was going to recognize our city solicitor to take us through what changes he is suggesting. All right, Mr. Kennedy, the floor is yours.
Yes, Mr. Mayor, members of the council, members of the public. The Mass Subcommittee of the City Council worked diligently earlier this month on drafting a face covering ordinance for the council's consideration. That is before you tonight, as well as a supplemental ordinance. And the supplemental ordinance, the revisions contained therein, and I'll go through the ordinance here in just a moment, but just to give you some background, the supplemental ordinance would be limited to retail establishments only. And so where the definition in the original ordinance was more broad for businesses, we found that in looking at the governor's reopening guidelines relative to all of the guidelines, which is a very extensive list, that definition of business was far more broad than I think the subcommittee was looking to regulate. And so we've used those guidelines to narrow the focus of this ordinance to retail businesses, which by way of example would be grocery stores, hardware stores, pharmacies, places like that, where while the governor's order requires employees of those businesses to wear face coverings, the recommendation from the governor is that customers should wear face coverings at those businesses. And this ordinance, the supplemental ordinance, and really the underlying ordinance, was to require that customers wear face coverings in those businesses. And so what I'll do, Your Honor, is what I'm going to do is go with the council's work from the supplemental ordinance to show what that ordinance is relative to what we're addressing here this evening.
Thank you. Does anybody object to that? Great. Seeing now, Mr. Kennedy, why don't you continue, please?
Okay. I'm assuming everyone has the ordinance and can see the ordinance. And so the way the ordinance is set up, it's set forth in section 13, which is our health section of the Code of Ordinances. And what we're looking at here is you'll see a number of whereases. That's the capitals, whereas, and what those whereases represent is some factual background of this crisis, this pandemic that the city of Concord, the state of New Hampshire, the United States, and the entire world has been going through for some time. And certainly since March 13th of 2020, the President of the United States has declared a national emergency. And so we take that And even this ordinance was drafted, as you'll see, initially on August 3rd. And at that time, the Center for Disease Control, who I'll refer to as the CDC, I'm all sure you know that term, we were looking at in excess of almost 5 million cases in the United States. I think I saw today that we're at that 6 million mark. And then we've got the background of the CDC giving some guidance as to what this coronavirus, COVID-19, is, how it's spread, and steps that you may take to safeguard yourselves from the spreading of COVID-19. And you'll see on the top of page 2, those steps may include wearing a face covering over a person's mouth and nose when they're around others. And I think that's the heart of this ordinance for retail establishments, is requiring customers to wear those face coverings when they're entering those retail establishments. You'll see there again, going through New Hampshire. Now we're looking at the United States, the world. Now we're looking at New Hampshire cases, and again, this was as of August 5th. I know that day to day this is changing, and really day to day the governor's orders are always are changing as well. And so I think that again makes it really important that we limit this to the retail establishments to be consistent with what the governor is trying to accomplish here. So we go through here, we've got some numbers here in New Hampshire. The Department of Health and Human Services is recognizing it in all 10 counties. We're looking at outbreaks here in comparison to other states and countries. We have, as you all I'm sure know, the New Hampshire State epidemiologist, Dr. Benjamin Chan, is talking about mitigation efforts and has offered much welcome guidance in responding to COVID-19 here in New Hampshire. We've got how New England and New Hampshire is dealing with these outbreaks. And certainly the CDC, again, is recommending that people wear face coverings in public settings to offset and divert the spread of this disease. Sununu, our Governor Sununu, I'm sure you have seen or may be familiar with the executive order declaring the state of emergency. As of August 12th, we have 63 emergency orders concerning how the state of New Hampshire is addressing the COVID-19 pandemic. And then certainly the next 3 whereases are where we're adding some more background relative to the retail ordinance. And there it is. The governor's emergency orders include a requirement that certain businesses and organizations shall be required to comply with a sector-specific guidance recommended by the governor's economic reopening task force. And that's that task force that's identifying all those types of businesses, those health clubs, the barber shops, the hair salons, massage parlors, everything in those emergency orders for reopening are contained and come from that task force. The governor's emergency orders for retail establishments, and that was recently updated in June 29th, and that for retail establishments, which you'll see below is a defined term, state that all staff, and so let's be abundantly clear that all staff of those retail establishments that we're talking about are required to wear face coverings at all time when in the retail facility and in public locations or shared staff areas, even if other individuals are not immediately present. And there again, this other whereas was added. You won't see it in the original ordinance. The governor's emergency orders for retail establishments recommends but does not require customers. Okay, now this is a distinguishing factor where our ordinance would come in. Does not require customers to wear face coverings at all times when inside the store. The next whereas is you'll see that there's been some litigation both at the federal level, at the United States Supreme Court, and there's also been some New Hampshire cases relative to these mask ordinances that to date have been upheld. Again, this is a global pandemic, and states, municipalities are responding to this in the best way that they can. I'm sure that you know that there are a number of other municipalities in the state that have adopted mask ordinances. There is a statute here in New Hampshire, the Communicable Disease Statute, RSA Chapter 141C, to prevent, identify, and control and eradicate communicable diseases like COVID-19. That's the purpose and intent of that statute. The purpose and intent of this ordinance would be to help prevent the spread of COVID-19 through mask coverings. RSA 4717, Roman numeral 15, is what authorizes this council to enact ordinances to safeguard the health and safety of the citizens here in Concord, people visiting Concord. This is the statute giving our city council the authority to do that. Herein, we look at some additional law relative to the council's authority to enact ordinances, and to the extent that the city council adopts this ordinance, they're making the finding expressly here in the adoption thereof that this ordinance is necessary to help prevent COVID-19 within retail establishments. And so that's the background here. Now going under the now therefore, you'll see we've got a 1 through 1 through 8 now as to what this ordinance would do. This is stating, now therefore, based on this background that we have here in the findings that the council has made, this is what they're stating. And so number 1, we define the face covering. It's defined as a covering made of cloth, fabric, or other soft or permeable material without holes. It covers at least the nose and mouth and surrounding areas of the face. Face covering may be factory made, homemade, or improvised from ordinary household material. Now, this is the term number 2, retail establishment, is used here in retail establishment, includes all businesses, organizations, and facilities that are required to comply with COVID-19 reopening guidance issued by the governor's economic reopening task force for retail. Okay, that's what we're talking about here. By way of example, retail includes, but is not limited to, buildings or structures, or portions thereof, for the display and sale of commodities such as department stores. That would be like Marshall's or Burlington Coat Factory or Home Depot, right? Drug stores, convenience stores, retail or wholesale stores, grocery stores, home improvement, where such commodities are available for immediate purchase and removal from the premises. It does not include businesses that have incidental retail sales directly related to the services rendered by the business, such as cosmetology, barbering, health and fitness center facilities, unless the sector-specific guidance issued by the governor's reopening task force for that industry requires a retail guidance. So what this council is saying, to the extent that they adopt this, would be that they are not governing or having any regulation relative to these types of entities, these fitness facilities, for instance, because in those health clubs facilities, the governor has made guidance as to what the face covering requirements are in those types of facilities. And this council, to the extent that they adopt something like this, wouldn't be interfering with that guidance. And then again here, to make clear, to avoid any uncertainty or doubt, this ordinance shall not apply to the food service industry. Okay, so that's a term of art, food service industry, but basically what that means, restaurants, right, or catering facilities, that this ordinance is not going to apply to. It's not going to apply to places of worship because those areas are subject to the governor's orders, as well as a number of other areas. But I know that was an issue that the committee had looked at and wanted to make clear to people that we were not, the city of Concord would not be regulating those industries, because that is an area or realm that the governor has taken complete control of. Customers are required to wear a face covering at all times in the retail establishment, including any outdoor retail areas where business is conducted. Now, something I wanted to make clear about is that under the governor's orders, this would not include anything like an outdoor farm where there might be apple picking or anything of that sort. So those types of areas are covered under the governor's orders, and that would not constitute a retail establishment unless, of course, there is a retail component to the apple farm or the strawberry farm. So, for instance, if that apple farm or retail farm that has the outdoor picking had a retail shop where they're selling certain commodities within inside that shop, then that retail shop itself would be subject to this ordinance. But the outside picking area would not. And that falls in line really with number 4 here, relative to members of the public utilizing the city trails, sidewalks, and other pedestrian public ways or public recreational lands may be encouraged to wear face coverings when 6 feet cannot be maintained between people, not the same family. But it's certainly not going to be a requirement of this ordinance. And this here and this next one, number 5, face covering should not be required for children under 10 years of age. We believe that, at least to the extent that the council were to adopt something like this, would be left to the parents of those children. And this you'll see in many other ordinances throughout the state. 10 years is what other towns at least have adopted, although the CDC has not expressly offered comment there. And then, but where the CDC has is that face coverings are not recommended for children less than 2 years of age. We're almost finished here. A face covering is not required to be worn by any person for whom wearing a face covering may pose a risk for health-related problems. So certainly the council is not interested in creating or intensifying any health issues for anyone. In these cases, the council would be requesting that those persons maintain 6 feet from other individuals. And number 7 here is important because to the extent that this ordinance conflicts with stricter requirements set forth in the governor's emergency orders, the governor's orders shall apply. And so to the extent that the governor's orders requiring something beyond a face covering for retail establishments for customers, then those governor's orders would apply. But right now, as set forth in the whereas above, you'll see that the governor's orders recommends face coverings for customers, but is not required. And then section 8 is the penalties section, which is largely modeled after the city's parking enforcement policy and practices and procedures. And I'm available for question, Your Honor, if the council has any questions.
Thank you very much, Mr. Kennedy. I want to try to get to allow people to testify as quickly as possible, but does anyone have a question for Mr. Kennedy that they would like to have answered before we get to the public hearing? Councilor Rice-Hawkins.
Thank you. And thank you for clarifying that pick your own won't be covered under this. I know that was a concern for several of our local farms. Would the downtown farmers market be subject to this?
No, I believe that also is going to be covered under the governor's is strictly an outdoor event that's going to be taking place within the city's right of way. And so that would be not subject to this.
Thank you.
Any other councilor? Councilor Fennessy.
Thank you, Your Honor. Question I had for you, Mr. Solicitor, is in looking at the ordinance itself, it doesn't indicate how we intend to enforce this. Do we have an expectation, or is that something as a council we need to discuss how we intend to actually enforce the ordinance?
So for enforcement of ordinances, like any ordinances, it would be complaint driven, I expect. And to the extent that the city receives complaint, it would be our code enforcement office or the police department is the entity that typically enforces the city's ordinances.
Thank you very much. Anyone else? Okay, seeing none. This time we'll open the public hearing. And the first person I'll recognize is Jim Potter, please. Good evening and welcome. Could we unmute Mr. Potter?
There we go. How was that?
Wonderful. Thank you. Good evening. Welcome.
Good evening. Thank you, Your Honor, and city councilors. My name is Jim Potter. I am at my home alone in my office. I'm a resident of Concord and also serve as the Executive Vice President and CEO of the New Hampshire Medical Society. In that capacity, I've been intimately involved and helped shape a number of the state's policies on COVID-19 pandemic, and currently serve on the state's Crisis Standards of Care State Disaster Medical Advisory Committee. A couple baseline points right up front. Masking, social distancing, enhancing hygiene strategies does inhibit the spread of airborne COVID virus transmission. Those facts are indisputable, and it is our best tools to flatten the infection curve. Testimony to the contrary is highly likely to be playing loose with the details. That is why in June, the Medical Society helped convene numerous stakeholders such as the New Hampshire Hospital Association and the Business and Industry Association of New Hampshire, including the vast majority of local chambers in the state, to form a voluntary Mask Up New Hampshire campaign with a goal of promoting voluntary mask use, social distancing, and enhanced hygiene to help keep infection rates relatively low through August, so that schools in the Granite State could have a fighting chance in reopening. I believe that we've been successful in achieving that goal, and paraphrasing state epidemiologist Dr. Benjamin Chan, that New Hampshire has maintained a, quote, low but persistent COVID-19 infection rate. In particular to Concord, I think you can think of it as a pivot point because of its relative size and location. With only 5 currently known active cases. To our north, most communities have maintained a relatively low or no active cases. From Manchester south, we more resemble the higher infection rates of Manchester. And this is where the preponderance of infections and deaths in New Hampshire have occurred. I believe, having reviewed the draft ordinance that is as presented, it is fair and balanced, particularly in deferring to the governor's emergency executive orders. However, there may be some quibbling with respect to requiring masks for children under the age of 10. There is more recent evidence that younger children may be the, quote, super spreaders of COVID-19 where community transmission is prevalent. And I want to key on it's where community transmission is prevalent. We don't have that currently in Concord. And it's also more of a question, can you reasonably get children to routinely wear masks in public areas where social distancing cannot be achieved? Clearly, the COVID tide can turn at any time, and it doesn't take too many bad decisions to change things. Just because the city of Concord and New Hampshire in general have been performing well so far, it doesn't protect us down the road. Since this is limited to just retail establishments, I'll cut my other comments, and then I have a potential compromise, and I fully understand that compromise can be a dirty word in today's culture. But that compromise would be a new item in the proposed ordinance for a set or a trigger or a set of triggers for implementing the masking mandate policy based on specific infection metrics. That trigger could be some form of the 4 metrics routinely cited weekly by David Brooks in the Concord Monitor, and often cited by Dr. Chan and other epidemiologists. It's an inducement for good cooperative and reinforcing behavior, stay below the trigger metrics, and the mask mandate does not go into effect. Spike above it, and the policy goes into effect through January 2nd, 2021. Thank you for the opportunity to testify.
Thank you very much, Mr. Potter. Does anybody have any questions for Mr. Potter? Councilor Champlin.
Thank you, Your Honor. Ms. Potter, thanks so much for coming tonight and testifying. We've had a number of communications from constituents that have indicated things to the extent or things along the lines of the World Health Organization has indicated that fabric masks should not be used. There have been studies that indicate that masks can be detrimental to your health because you're inhaling CO2, things of that nature. Could you comment on those from your position with the Medical Society?
Sure. Now, we're aware of a lot of misinformation out there. The idea of you're inhaling more CO2, that's somehow you're reinfecting yourself. There's a series of myths out there right now on that. There's also a lot of misinformation on the use of masking. But I think in general, one could say that any type of mask essentially inhibits the viral spread or droplets of the virus. That's the intention, whether it's a full N95 or a KN95 or some kind of double cloth face mask. All those things will help inhibit that spread.
Thank you. Follow up, Your Honor?
Yes, please.
Thank you. Mr. Potter, we've also heard from people saying, well, you know, our rate of infection is so low in Concord, you know, our rate of hospitalizations are so low, there's really no reason to consider any sort of a mask ordinance. You kind of touched on this in your comments, but I wonder if you'd speak to that more specifically.
Well, I think we've done well up to this time. Our goal with our volunteer effort was to essentially give schools the opportunity, whether the colleges, whether it's opening up child care centers or others, give them the opportunity by maintaining a relatively low infection spread. So we don't have what is kind of called community spread in Concord right now. That's true. That doesn't mean that if schools go back, that through an athletic event, through some school, that we have spikes. That doesn't mean that non-compliance won't rear its head. Often, if you look back at the history of the 1918 infection, is essentially communities relaxed and then saw a secondary spike. I think most epidemiologists anticipate some type of spike into the fall until we have some kind of vaccine. I think you can reasonably say for about the next year, we're going to be in this gray zone for the pandemic.
Thank you. Thank you, Your Honor.
Thank you. Councilor Kretovic?
Thank you, Your Honor. Mr. Potter, thank you so much for your kind testimony this evening. It's very much appreciated. There is an item in this ordinance that recommends that a face covering is not be required by persons for whom wearing a face covering may pose a health risk. There's a number of people that have provided testimony in advance of this public meeting stating just that they don't want to alienate people with medical issues in this ordinance. And yet the CDC states that a person that is under 2 years old, which of course we've already identified, a person that cannot breathe, or a person that is unconscious are the only items by which a health item would preclude someone from wearing a mask. Would you agree with that? Or is there something else I'm missing, some other condition that would prevent someone from wearing a mask in our community? Thank you.
You know, that's a great question, Counselor. It's been hotly debated. I think my colleagues across state medical societies and other epidemiologists basically said, if you have a condition that prevents you from breathing through a mask, a cloth mask, you probably shouldn't be in public or an environment that you would endanger yourself. And so the rule of thumb has been most folks who come up with some kind of medical condition in other states, they said, we really don't want to go defining specific conditions. So I think as outlined in the current ordinance, I think that's what you have is reasonable.
Thank you.
Thank you very much. Councilor Pierce?
Thank you, Mr. Mayor, and thank you, Mr. Potter, for your comments. Very quickly, you talked about, in this ordinance, we talk about not requiring 10-year-olds, children under 10 to wear masks. And you did talk a bit about, you know, that's still suspect. In your estimation, what is the right age?
That's a great question. I don't know if you can pin one on. I think it's, as I alluded to, I think it's, can you get a child at a certain age? I don't know whether that's 5 or 6 when you get them to maintain wearing a mask for any period of time. I know just personal experience trying to get a toddler or someone under the age of 5 or 6 who is not in school, that becomes very, very difficult. The question also goes to if students are back and are in school and are in places that social distancing can't be enforced, do you want them wearing masks? And my own personal opinion is, yeah, probably. It's what we do. I'm also a head of a small business. While we're in a historic building, we each have our own offices. When we go out of those offices, we put on masks. And we do all the hygiene and everything else in the social distancing. So I think that the age of 10 has been used as solicitor mentioned by other towns. I don't know if there's any basis of that. Can you go lower? Probably yes.
Okay, thank you very much.
Mr. Potter, that seems like it's the end. I just have one quick question for you. And that is, could you just, I know you said it twice now, but I just want to repeat it one more time. Could you just explain the trigger piece one more time?
Sure. In my way of thinking, you could have a trigger. The easiest, if you go to what has been put out by David Brooks on a weekly basis, he has 4 goals or 4 metrics that he has derived that is often used by Dr. Chen and other epidemiologists. And so they basically cite certain facts of whether there's a prevalence of 2 weeks, and all of them go to trying to establish, is there community spread, or is there a good preponderance of evidence that community spread is occurring in a local community or in a state. And so if you'll see in his articles, he uses those as a basically barometer of community spread or community transmission. So far, the state and Concord have been below on all those threshold metrics. But I think having something like that, and the balance for me is you're going to get a backlash by this. And I think is, does that induce more non-compliance, or does that help with your compliance as you limit it to retail establishments? So that's really the decision point. But I can send you that information, Your Honor, and I'd be happy to work with you and other epidemiologists on what those potential triggers could be.
Thank you very much. Seeing no other council's hand raised, Councilor Kenson, if you could just use the hand raise button icon, that'd be great. But for this time, Councilor, the floor is yours.
Thank you very much. If I understand this correctly, Mr. Potter, you're suggesting that we use those metrics as to whether or not to put this ordinance into effect or keep it in effect. And if I'm understanding that correctly, those can change, those metrics can change, whereby, one week we're all good, and then maybe 2 weeks later we're not. And I'm trying to understand, if those were the metrics we were using, how does it affect this ordinance and when it would be in play?
I think thank you for your question. I think a reasonable argument can be made that we have, the community spread is not present in the city of Concord and in most of New Hampshire right now. So this will come down to a personal kind of policy debate. I'm offering you or the council a way to determine where that threshold, hits. What I like about this ordinance is it's only through essentially the end of the year for 4 months, and then we could reestablish it. But I think if I had to guess, we're going to see a spike at some point. And so what the metrics or some, invoking this measure, and once in effect, because it's a short duration, I would just keep it in effect. But that may be a balance between those who say we have a very low rate, and it could also be seen as an inducement. If everyone works together, we keep our rates low, then no masking works. If you go about that threshold, then most of these can be done over a multi-week period. So it's not a snapshot in time. Oh, you're above today or you're below, or you have one incidence of, you have one gathering who got infected, but it looks at more averages over time. And so I think what we're really trying to do is say what constitutes community spread, and try to objectify that as much as possible. That may help you get between those who say, no, there's not a need, and yes, there is a need. So that's the best option I could think of right now to kind of give the council a potential way to put a little bit more science behind this.
Thank you very much, Mr. Potter. I greatly appreciate your testimony tonight. Thank you again.
Thank you, Mr. Mayor.
And next, I'd like to recognize Kip DeVries, please. Good evening. Welcome.
Oops.
There you go. Could you get unmute, please? Mr. Manager, could somebody please unmute Kit DeVries?
Am I muted now?
You're all set now. Welcome. Good evening.
Thank you, Your Honor, and giving me the opportunity to speak. What I was basically going to do was reiterate what I had said in my message this morning, how very, very important it is. I'm a therapist here in Concord. I've been a therapist for 29, almost 30 years now. And to work with the people that have lost loved ones and have gone through the suffering of COVID, I mean, in my mind, if we can save anyone, regardless of who they are, by applying this ordinance, I think we should do it. Human life is vulnerable, and I can't see waiting 2 weeks for having a community, what do they call it? I'm sorry, contagion, and losing that many people to justify wearing a mask.
Thank you very much. Does anybody have any questions for Mr. Reese? Seeing none, thank you very much for your testimony tonight. Greatly appreciate it. Have a wonderful evening. Next, I'd like to recognize Alan Cantor, please. Good evening, Mr. Cantor.
Good evening, Mr. Mayor. Thank you very much. And thank you all to the members of the council. I hope you can hear me. I am not a doctor. I'm a resident of the South End. I can't comment as an epidemiologist, but I would agree with the last comment from Mr. DeVries that let's prevent a spike. Let's not react to it. We've been fairly smart and very fortunate, and let's stay ahead of this. I think the public health benefits are unquestioned. But I'd also like to speak about the health and safety of the folks who work in our retail establishments. I'm really conscious of, I'm very cautious about going into stores where people are unmasked. I don't feel safe, and I leave. And I go somewhere else. But there are a lot of folks who don't have the option to leave because they're working there. And I think it's kind of like the argument years ago about secondhand smoke in restaurants and bars. The folks who worked there and were there all day were breathing it all in. And I think if we allow folks, customers, to visit stores without face coverings, the people who are workers, they're breathing it in all day, and they're the ones who are at risk. They're also the ones who have to deal with irate customers who say, who contest the request to wear a mask. There are a lot of stores in town, and I applaud them that are requiring masks. But sometimes the staff get into arguments with customers. If they could just say, hey, it's a city ordinance, a city mandate, then I think that reduces some of the pressure. I've talked to a couple of store managers who said it would make their lives and the lives of their staff much easier. So I really think I'd really like to focus on the health and safety of the people who live there. And I think to a certain degree, the economic vitality of our retail establishments. I don't know. I know there are people who feel strongly about masks as a civil liberties thing. And I respect their point of view, but I don't know anybody who won't go into a store because it's too safe. There are people who won't go into a store because they perceive it as dangerous. So I applaud you for taking this on, and I encourage you to approve the ordinance. It'll make our community safer, and it'll make the people who shop, and especially those who work in the stores, safer.
Great. Thank you very much. Does anybody have any questions for Mr. Cantor? Seeing none, thank you very much. I appreciate you joining us this evening. Next, if we could recognize the phone number, it's 603-226-4588. Good evening. If you might just be willing to share your name with us and where you're calling from. Could we please unmute this number? Good evening. Welcome.
Hi, can you hear me now? Sorry.
Yes, gotcha.
First time doing it. My name is Greg Gilbert. I'm a longtime resident of Concord, Ward 10. And a lot of people have already spoken about the merits of the mask or not and how to go about it. I'm not going to ask about that, but I wanted to ask the mask subcommittee if there was consideration about the legality of an ordinance like this, given that the governor has already issued executive orders stating which businesses require customers to wear a mask, and that other businesses and outside of that, customers are not required to wear a mask. The city of Concord being a lower authority to the state and the governor to issue an ordinance that is in conflict with that is, I understand cases have been upheld against the state and the governor's orders, but in this case where it's a lower authority issuing an ordinance that conflicts potentially with a governor's executive order, is this even going to pass a legality check on this ordinance?
Okay. Mr. Gilbert, do you have anything else you want to share?
Nope, that's all. I appreciate the time. Thank you.
Mr. Gilbert, before you go, do you have the access to the ordinance?
Yeah, the one that's on the website. I don't know about the updated one that was,
if you look at section 7, that didn't change. That should answer your question.
Okay.
Okay. Thank you very much. I really appreciate you joining us tonight.
Thank you.
Could we now recognize Cheryl Rounds, please?
Hello, can you hear me?
Hi, welcome.
Thank you. I'd like to make a few comments. First of all, as far as going in and not feeling safe, I feel very safe. I don't like to go in when there are a lot of masked people. I feel very uncomfortable. It turns the whole energy of the store to fear. Instead, as smiles create a very loving and friendly environment, masks create a very hostile environment. And I feel threatened when I'm in a store with masks. Secondly, last week, the CDC just came out with new statistics that said the masks were ineffective as far as preventing COVID. If you look at the box of masks, the surgical mask and the N95 mask, you will find the boxes clearly state that they do not stop a viral infection. Surgical masks were intended for surgery to stop the medical staff from contaminating an open surgical wound. The masks are used in a controlled air conditioning environment. The environment is sterile, and there is extra oxygen pumped in to compensate for the fact that whoever is wearing the mask is not breathing in as much oxygen as they normally would. This is not the situation in retail environments and indoor stores. People are constantly touching the mask, contaminating them. They're bringing whatever they have touched right up to the mask surface, which they're then breathing in. So the mask is not helping to stop infections. The CDC also determined just yesterday or the day before that the infection rate is actually only 6%. The people that died, 6% of the actual death count, and the rest of the people died with comorbidities. So we're looking at a very, very low infection rate of people dying. And where we are trying to create a mountain out of a molehill, the mask is not going to do anything except make people sick and make them feel safe. But in reality, the masks do a lot of harm. And I'll be happy to forward a lot of scientific evidence regarding that. And there is no science that says the masks work.
Great. Thank you very much. I appreciate your comments. Ms. Rounds, if you could just, for the clerk, just tell us where you're calling from, that'd be great.
I'm calling from Derry, New Hampshire.
Derry. Okay. Thank you so much. Appreciate you sharing your thoughts with the citizens of Concord.
I have a whole information sheet with over 30 links that I'll be glad to send to all of the council people so that they can check out the facts for themselves.
If you ever want to send anything, and you can always send it to our city clerk, and the city clerk will make sure it's distributed to everybody.
I will send it tomorrow.
Thank you so much. Appreciate it. With that, I would like to recognize Mr. John Gaudet, please.
Hello, everyone. Can you hear me?
Welcome. Yes, good evening. Before you start, I just wanted to say that we all got a copy of your very, very thorough email this morning. Very much appreciate the time and effort you put into it, and it was well done. So thank you.
Oh, thank you very much. And thank you, Mr. Mayor and Council, for allowing all of us to speak. I wanted to just highlight a couple of items for folks that didn't get a chance to read what I submitted. There are numerous studies dating back all the way to 2012 that dispute the efficacy of the general public wearing face coverings. And I understand, Mr. Potter's perspective on the subject, but the documentation there is clear from the WHO right to the University of Minnesota. So these aren't fly-by-night studies that have been done in a silo trying to go ahead and dispute a fact. These are studies that have been scientifically and methodically driven to make sure that the outcome was sound. Beyond the masks, I think that the documentation I submitted does show that the face coverings that we're using out in public are not doing anything to stop the spread of COVID, where our success is really coming from washing our hands, not touching our face, and making sure that we're not sneezing and coughing on each other. There are a couple of points with the both the original ordinance and the amended ordinance that I'd have concern about. The first one is around the health exception. Mr. Potter attempted to weigh in on the types of medical situations that may be exclusionary. And I know that I believe it was Councilor Kratovic who had also asked that question, referenced the CDC. But there are a number of physical ailments that people have, but also psychological ailments that they have that may preclude them from wearing masks, such as PTSD, etc. But the ADA federal regulations state that if somebody has a health condition, that nobody can ask them what that condition is because it's private information. So if we were in a situation where somebody said, I have a health exception, the police officer's standing there, now what? How would we expect the officer to respond, knowing that the person who they're asking wouldn't have any legal duty to actually answer the question? It would seem that we'd be putting both of them just into a very uncomfortable situation. Was there any thought as to how that would be addressed in real time?
Well, I think, Mr. Good, I think the important thing is we want to hear your thoughts tonight. I think obviously you bring up the issue of enforcement and efficacy, and I just, if you could keep going, and that'd be great. This is very helpful.
Oh, well, the reason that I ask is that I want to make sure that I understand, the solicitor's perspective, the guidance that, the council is being given in this part. We're in a situation here where we have a city that, as Mr. Potter said, we're not suffering through community spread at the moment. And every, death is a tragic one, and we don't want to lose anybody. But we don't go around recommending that we reduce all of the speed limits because there are studies that say that lower speed limits cause less traffic death. At some point, we set the speed limits and let people move around town. And frankly, most of us are speeding anyway. Let's face it, right? We all make the decision, as far as the risk is concerned. So in this case here, if we have the vast majority of people in Concord who are wearing, the masks in public, then we've demonstrated that we can keep the community spread low. There's no reason to go ahead and enact a mask ordinance that would needlessly begin confrontations with the folks that aren't wearing them. And, most of the folks that aren't wearing them haven't been walking around as, super spreaders, walking up, breathing on people. They've been, from what I could see, very respectful of the other folks that are around, just trying to go through and, live their lives and whatnot. So I would ask that the council consider both the enforcement of the health aspect of it, and also whether or not the use of our police officers' time or our code enforcement officers' time would be better served doing something else other than focusing on a mask ordinance. So thank you very much for the time.
And again, I appreciate the time you put into sending this email. That was very helpful. If I could just leave you with one last one, hopefully you find this as humorous. But
sure.
You used the example of a speed limit. I was contacted by somebody who lives on your road today who was looking to reduce the speed limit on Hot Hole Pond. So.
Well, I actually think it's on the books as 35, so they're probably right. Since if you hit some of those corners at 35, you'll be in a tree. So I'm willing to listen to that one.
All right. Thank you again.
Thank you, sir.
Appreciate your time.
Have a great one.
Next, I have Bert Cooper. Mr. Cooper, if you could unmute yourself. The floor is
I'm unmuted, Your Honor.
Welcome. Welcome.
So I'd just like to start out with a quote. "We're not defenseless against COVID-19. Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, particularly when we use it universally within a community setting. All Americans have a responsibility to protect themselves, their families, and their communities." That's a quote from CDC Director Robert Redfield. I've heard a lot of stuff where people quoting issues with masks. I take exception since the head of the CDC says this is our most powerful weapon. This is not political. This is science. This is using our police power to protect our citizens. As a former Rotarian, this is similar to something like the polio vaccine. You don't think we have a polio problem today, but that's because the prophylactic action of having a vaccine has stifled widespread havoc from polio. We don't have a lot of polio in this state. Just thinking that viruses don't exist doesn't really make them go away. It would be great if the counselors would lead by example and wear masks to guide the way for the rest of us. I don't know. I haven't been out and about that much, so I don't know if you guys wear masks on this on the streets of Concord. It's not a political thing. It is a science thing. Basically, this is overall dose and response. We have visitors from out of state and other parts of the state. So if we're having our ordinance dependent upon a certain Brooks barometer, we could be too late to stifle an outbreak. What we need to think about is we want to reduce the risk as much as we can. So where we can't reduce it, customers at restaurants, people at gyms, kids playing sports, young children at elementary schools, we can't, they're not going to be wearing masks. everybody else, when we wear masks, we reduce the overall risk so that they don't get contaminated. Anyway, last thing, I bike the Northern Rail Trail wearing a mask at a pretty high rate of speed. We can wear masks. It's the least we can do for our fellow citizens. The only other thing I'd say is, I think that in terms of exceptions, it should include people who might have like panic attacks for wearing masks, but medical or panic attacks. But that's basically my thoughts on this.
Thank you very much, Mr. Cooper. I really appreciate your time tonight. If you wouldn't mind just saying, as we asked the last couple of people, where are you calling from?
Concord, New Hampshire, 20 years.
Only 20? No,
only 20. I'm a newcomer.
All right. Does anybody have any questions, Ms. Cooper? Seeing that, thank you so much. Really appreciate you taking the time to share your thoughts this evening.
Thank you.
Next, could we recognize Sarah Robinson, please?
Thank you, Your Honor. Can everyone hear me okay?
You can. Good evening and welcome.
Excellent. Hi, thank you for giving me the opportunity to speak. I think the elephant in the room that we're really all mutually aware of is that there's a demographic of individuals that, regardless of an ordinance put forward by the city, will refuse to wear masks. That's just kind of what we've seen play out over the course of this pandemic. And what has been lacking in leadership on a federal level and at a state level, I believe the city has an opportunity to establish a set of values and leadership that has been lacking thus far. So I'd also like to address the fact that our kiddos are capable of wearing masks at very young ages. My 5-year-old is very skilled at wearing her mask and does so every time we are out in public. Kiddos who are participating in any kind of childcare situation or transitioning from one place to another are following those rules already. And we know that they're capable of incredible adaptation, more so than adults quite often. So I think asking younger aged kids to wear masks is not an out of line request. And as far as protecting fellow members of our community, there are demographics of our community that are disproportionately affected by COVID-19. Our Black and brown neighbors, the CDC and other medical entities have addressed the fact that in New Hampshire, there's a significant health disparity amongst those communities relating to COVID-19. So I would consider this a solidarity move in protecting those populations. That is all that I had to say. And if anyone has any questions, I'd be happy to answer.
Thank you very much. I really appreciate your thoughts this evening. Is anyone wishing to ask any questions? We do have a question. Comes from Councilor Keach.
Thank you, Your Honor. Very quickly, Ms. Robinson. So would you view this ordinance more as educational or enforcement? And there's been a lot of debate about what is most effective.
I don't know. I suppose you could view it as both. I mean, if you are unaware of the situation that we're all living in, then I would believe that would be via willful ignorance at this point. When you go into different retail organizations within the city of Concord, retailers are providing masks for folks who maybe don't have one available. There are retailers who are working to ask shoppers to please mask up. I witnessed just this weekend, a very popular retail destination downtown had to request that a gentleman leave because he refused to wear a mask. The city has an ability to support those retailers in those moments by providing this ordinance. And regardless, there will still be folks, like I said before, that will refuse to follow. And that is really, it's more of a statement of value on their part. So I ultimately considered this a state of value from the viewpoint of the city. We're the capital, we're the center of the state. What do we value amongst our community? And how do we make statements about that?
Good. Thank you.
Mm-hmm.
We have two other questions. One actually, Councilor Fennessy.
Mr. Mayor, thank you, Ms. Robinson, for joining us. You mentioned how your experience has been that younger kids have no problems wearing masks. If we were to change the age, is there an age that you think would be more appropriate than 10 years old?
Yeah, I have family members with children as young as 3 that are very capable of wearing masks out in public. And I think there are ways to ask them to do so where they will be fully compliant, especially when they see the adults and important people in their lives also complying. So I would say anything from 2 and up is fully capable of participating in wearing a mask, in my opinion.
Thank you. Okay, not seeing any further questions. Ms. Robinson, thank you so much for taking the time to be with us this evening.
Yeah, happy to do so. Thank you all for the difficult work. I sure appreciate it.
Actually, before you go, I'm assuming you're from Concord as well, right?
I am 45 Pennacook Street in Concord.
Thank you so much.
Thank
All
you,
right.
Chair.
Next, I'd like to recognize Zib Carell, please.
Thank you, Mr. Mayor. I really appreciate the council taking up this issue.
Welcome. Welcome.
I very much support, and before we move on, I'm in Ward 5. I very much support your action on this proposal. And in fact, I find it rather conservative, and that's okay. But I do think it's a statement, and I think it's a very important one that could have been made by our governor long ago to create unity. And you know, as I've listened to people, I'm finding myself agreeing with many of them. If we think back to where we were in April, you know, there was a lot of fear. There was a lot of unknowns out there. I remember listening to Senator Shaheen in May as she was doing different town halls and public comments. We were constantly hearing about flattening the curve. That was the operative message. And I think, you know, I'm in that group that's considered vulnerable by being over 60. And I happen to know a lot of people who fall into that category. And I'm not risk averse, but many of them are. And I would say that during the spring, Concord people generally were pretty conservative in what they did. Many people avoided going to the store. Yes, there were limits on your movement anyway, but a lot of people limited their activity entirely. And as the season wore on and options presented themselves, some people have taken advantage, others have not. Others have remained living very conservatively. But as we've seen things open up, we've also taken full advantage of the outdoors because not only is it for our own mental and physical health, but we've learned that it's a good place to be, relatively risk-free if you're not in close contact. All the specialists are telling us that's going to change for 2 very obvious reasons. Crowding through activities, particularly school, and more workplace assembly, and the change in the climate. And how many people have you talked to who are saying, what am I going to be doing in November that I can do outdoors? And God, do I dread the winter. And that is real. And along with that is the awareness for many people that they're kind of alone, maybe literally, but maybe it's figurative in that they're kind of on their own figuring out what the winter's going to be like and pretty scared about it. So anything we can do as a community, and I use that word generously, as people who care about our neighbors, as people who are committed to Concord, it's a show of unity that we wear masks and we ought to wear them maybe more than we're even required to wear them because we care about each other. So I'm all in on this.
Thank you very much. Appreciate you taking time to share your thoughts with us this evening. And wish you luck on election day. Could be a long day for you. Does anybody have any questions? Seeing none, thank you again. At this time, I'd like to recognize Vincent McHugh.
Yes, can you hear me now?
We sure can. Good evening, welcome.
Good evening. Thank you, Your Honor. Thank you, counselors. My main thing I'd like to get back to is there are 5 cases currently active in Concord, 16 in all of Merrimack County. So I think it's been already said, we don't have community spread currently. I think it's bad policy to put in ordinances for something that might happen. I think as a balance, the trigger might make sense where if there is community spread, sure, then maybe there'd be a reason to discuss this. But at this point, you know, the idea that maybe people going into stores who are unmasked are spreading it to others, that hasn't been the case because we have people currently going into stores unmasked and not spreading it. So while I do believe COVID is a serious issue, I think anytime we're about to put a burden on the people of Concord, we really have to consider, is this necessary? I think we've done a good job. I think we'll continue to do a good job, but I don't think this ordinance is necessary, at least at this point. I happen to be live on the east side of Concord, and I appreciate you taking the time to have this community hearing.
Thank you very much. I really appreciate you taking the time to go through this little Zoom technology with us and share your thoughts.
Thank you very much.
We do have one question for you, if you want.
Sure.
It comes from Councilor Krenvik.
Thank you, Your Honor. Mr. McHugh, thank you for your testimony this evening. Mr. Potter from the New Hampshire Medical Association had offered an alternative that if there were triggers that were elevated in our community, that the council could consider a mask ordinance then. Do I understand that you are perhaps in favor of the wait and see? And if things do elevate, that you would be in favor, or are you strictly against altogether?
No, I think if there is a community need, like we said, polio, or something, I mean, clearly it's not being demonstrated with 5 active cases, but if you had very specific triggers in place where it seemed like all of a sudden we're getting a big spread, then maybe at that point I'd be more willing to, you know, I'd be okay with it, because at that point I think we could say it's necessary, but I just don't see it with 5 cases in Concord. I think it's too much of a burden on the people of Concord.
Thank you very much.
Thank you.
Okay. Seeing no other questions, thank you very much for taking your time, Mr. McHugh. Next I have is John Draghi. Mr. Draghi, if you could unmute yourself. Or could somebody unmute Mr. Draghi? I think we may have lost him. Mr. Bahia, did we lose Mr. Draghi?
I believe we did, Your Honor.
Okay. Then we'll move on, and if he comes back, we'll go right back to him. I'll recognize John Smoes, please.
Hello, everybody. Can you hear me?
Good evening. Welcome.
Thank you, Mr. Mayor. Thank you, councilors. I live and work in downtown Concord, and I want to say that I appreciate what you're doing here tonight. Thank you. I'm very sorry that this falls to you, but our national and state leaders have failed to lead here, so I respect your leadership. We've seen tonight on this call just how political this issue has become. But I don't think we have the luxury of being divided. We are talking here about prevention. We can't listen to junk science. We can't listen to distortions. Because I think we're going to be very sorry if we do and things get worse. Like Alan Cantor, who spoke earlier, I am alarmed by the lack of masks in our Concord stores. I have a son with asthma, and seeing so many people indoors without masks scares me for his life deeply. We wear a mask to protect others. It's a small thing to ask. You know, we've got an aging population here in Concord. We have several retirement communities here. So I think what we're asking here tonight is a small step, but it's a smart one. And I hope and I thank you for taking it.
Thank you. I appreciate you taking time this evening. Is there any questions? Seeing none. Thank you again, and appreciate your time. Next, we have Mary Deal, please. Good evening, welcome.
Hi, thank you to you, Mayor, and all the City Council people. So I don't know all of you, but I am a retired physician, and so I am speaking both as a citizen of Concord. I'm home alone right now, and you know, with some medical background. So I've been taking notes on what people have said, and I really appreciate what Dr. Potter had to say, but I really feel that the one thing this ordinance needs is more protection for children. So as a physician, I was a pediatrician. I was a school physician for an entire school district in the community I was in. I was an advisor for the Head Start program. And I also, part of my life was a teacher of preschool kids, daycare center kids. I firmly believe that children 2 and up can wear masks. And that is what the CDC recommends. And I just feel like there needs to be more teeth in this ordinance. I think that by setting a good example, the city can do what our governor has not done. And I realize there'll be occasions where certain people will ignore the mask mandate. But if you set the norm, most people will follow. I have family both in California and in Texas. And Texas is a very conservative governor, and yet he made the right choice many weeks ago. And I hear from my family who lives there that it really made a difference. The compliance really went up, and there just weren't big fights about enforcement. I know that's an issue you worry about. I just think that some people have been really eloquent, Ms. Robinson, Jamie just now, about that we could make a statement as a city. I've been calling the governor's office for the past 6 weeks on almost a weekly basis, begging him to issue a statewide mandate, and I've gotten nowhere. So as a result of that, every city in this state is having to reinvent the wheel. And I appreciate that you're undergoing this. I know it's a difficult decision, but it's just so ridiculous that you're having to do this. Anyway, so that's my plug. Really consider following the CDC guidelines for children 2 and up. And I thank you for any questions.
Thank you very much. I don't see any questions, so thank you again. Really appreciate you taking the time.
Okay, thank you.
Next, I'd like to recognize Brian Blackton, please.
Hi, can you hear me?
Good evening, welcome.
Hi. Good evening, and I'd like to thank you all for taking this position on. I would like to just point out a few bullet points for you to ponder and just think over as you go over this unfortunate topic. This is your chance to be leaders and not followers. And I believe forcing things upon sick people like a quarantine is a medical response. And forcing healthy people to use masks or a vaccine is tyranny. We are seeing fraudulent numbers merely to raise the COVID pandemic scare numbers. And I would like you to contemplate that this is a reaction and an issue that doesn't need any reaction to. This is a politically feel-good measure. If you take time to read the scientific evidence, COVID penetrates any masks out there, including the famous 95, which are only about 80% effective, making the homemade bandanas and masks way less effective. And I read in the patch today that one of the reasons somebody wanted the city council to pass this was so that they could blame the city council that it is a rule that the city passed, so everybody has to wear masks in their store. And I don't think that's fair from a retail standpoint. And the other thing that bothers me is from a law enforcement standpoint. As a former police officer, I think this is a very dangerous way to go for law enforcement because they can't read people's faces. They can't identify people. And I think that is extremely scary. And I think that adds to the concern of police officers nowadays. And one more point is, if this is such a dangerous pandemic in this area, why have we never seen a hazmat biological disposable unit like we do a Sharps case when we see needles? And we have not seen any of those anywhere. So I think that's something that needs to be taken into consideration in this process. Thank you for your time.
Thank you very much. Appreciate taking your time, sharing your thoughts with us this evening. I don't have any questions, so Mr. Blackton, be well, and thank you again. Next, I'd like to recognize Jason Gerard, please.
Good evening, councilors.
Good evening, welcome.
Sorry, I panted a little bit. I was just running out on the backwoods. I would just like to address something that no one's mentioned yet.
Mr. Gerard, take your time, catch your breath, okay?
Sorry, I figured I'd get some exercise while you guys are chatting. But anyway, I've been listening to the whole thing, and I just don't understand why no one's addressed the New Hampshire Constitution, and specifically General John Stark. Live free or die, death is not the worst of evils. And I mean, New Hampshire is a beacon for freedom. Look at the Free State Project. It's the last state has not endorsed or enforced a mask mandate. And I'm in Northfield, but I work in Meredith. I shop in Concord often, but I'm in Meredith, and you have New Yorkers and you have out-of-staters all over the place flocking there because it's a beacon of freedom. And people are moving from Mass, as you guys know, to avoid Massachusetts nanny state mentality. And I think you really got to look back on what Concord is, the state capital, and what New Hampshire represents. And one other thing, getting back to the law enforcement aspect, you're creating a situation where you have an officer address somebody, where's your mask? The guy says whatever he may say, because we're assuming everybody's a logical individual, which they're not. There are a lot of mentally unstable people, people that are on drugs, and all the rest. And now all you need is a confrontation, somebody gets shot, and now you have all these BLM people and the rest protesting in Concord, breaking windows, all over what? I think you need to kind of look further than just we got to have solidarity. Yeah, you need to have solidarity over the Constitution and your rights and privacy. And just think about that. I don't know. It's just something that's very important to me. Thank you.
Thank you. Appreciate it. And appreciate you sharing your thoughts with Citizens Concord, and always encourage you to come shop here anytime. I do have one question for you, sir, and
Sure.
it is from Councilor Keach.
Thank you, Your Honor. Thank you, Jason. I really do identify with the points you made, but I also have to ask you, I don't ask your age, but as far, I'm 58. As long as I was growing up, you had to wear shoes in a store, a shirt in a store. So how is this a lot different from like some basic rules that might be inconvenient, but a retailer has the right to ask that of a person coming in?
Indeed. Good question. And it comes down to the basic premise of private property. Any business can say, I don't want X, Y, and Z entering my premises. That's the whole thing of property rights. And if businesses want to institute those rules, so be it. They shouldn't have to say, no, the counselors are making me do this. They need to grow up and say, I'm a business owner, this is my property, and this is what I want. And as long as it doesn't infringe on, the normal sex, gender, all that stuff, then so be it. It's not your job to give people a reason to enforce BS stuff. I mean, I'm sorry, but yeah, I just think you need to remember what your job is. It's to protect the rights of your citizens. And health issues that are very suspect. I mean, you got to look at the science, guys. This is not concrete as they're trying to make it out to be. these masks are phony baloney. People do not wash these things. You know what I'm trying to get at? It's not some kind of thing where people are pulling out brand new masks every day. They're leaving the same raggedy one in their ashtray. I'm sorry, I'm just running and I can't get my thoughts together. But just think about the Constitution and read it, because listen, our is the right to revolution. And I know you guys think that this is just one thing and it's going to stop. No, it's not. The people from DC are going to put the press on you guys to enforce vaccination. And you say, no, you won't. No, they won't. They're going to stop your state funding and federal funding. And that's where we're going, guys. Just stop it now. Stand for the right things, or you will have a problem. There are people that are angry. I know them. I mean, just, it's not everybody. I don't know. Just think about that, guys. You have a bigger right. All right.
Appreciate your input. Thank you.
Thank you very much. Next, I'd like to recognize Kelly. I just have a first name.
Hi, yeah. Can you hear me?
Oh, you can, Kelly. If you wouldn't mind just sharing your name and where you're residing tonight, that'd be great.
Hi, yes. My name is Kelly Anderson, and I live in Concord.
Welcome.
Thank you for having me and allowing me to speak, and I apologize if there's any babies crying in the background. We have a 4-month-old, and we just got our 2-year-old down, so thank you for allowing me to talk. I just wanted to kind of respond to Sarah Robertson and Mary Deal when they were talking about their children. And Sarah had said that her 5-year-old is very well skilled and capable of wearing a mask. And Mary Deal said that she believes that all children 2 and up are fully capable and they model their parents well. How about my 2-year-old with Down syndrome? He will not wear a mask, and I won't make him wear a mask. He was born with oxygen issues. He was in the NICU for 2 weeks. He came home on oxygen. He has very narrow airways, and there is no way, and I'm telling you, he will wear a mask. It's just not going to happen. So I feel very strongly about that. If you are going to go through with this mandate, and I don't agree with it, but if you are, I think your age of 10 and up is appropriate. We also have an 11-year-old and we have an 8-year-old. So anyways, I had one more question besides the children aspect. If the masks are going to be mandatory, will you choose one type of mask, or is just anything going to be allowed? Like, I saw that it's anything you can make at home, but shouldn't something that's like proven to be effective be the only thing, not just like a bandana or face covering like that? And I guess that's really what I wanted to say.
I appreciate that. Good question. And section 1 of the ordinances, is, a proposed ordinance would be kind of, I think, cover your question.
Okay, thank you.
Thank you again. We do have a question for you if you're willing to answer.
Sure, please. Thank you.
Your question comes from Councilor Rice Hawkins.
Okay. Thank you.
Hey, thank you. Thank you. And appreciate you calling in. We all know what it's like when you're trying to get kids down to sleep and participate in civic life, so appreciate it. I just had a question about your young son, and I'm just curious, have you been taking him into retail establishments, or how are you handling that? I know as a mom of 2 young children, we've been trying to avoid bringing the kids when possible and masking up when not, so I was just curious how your family's dealing with that. Thank you.
Okay, thank you for asking. Well, we have 4 kids now, so I was saying Jack was supposed to be our last, but he has Down syndrome. And so rightfully, technically he's supposed to be considered immune compromised, but he has been, other than the oxygen, he does have the narrow airways and the narrow ears, so he has issues with that. I usually don't take them to the store unless I have to. We've taken the baby out, we've taken them out to restaurants to eat, and none of us wear masks. And that's just how we've been the whole way. But we've been cautious, and I was cautious. I was pregnant too. I gave birth in May at Concord Hospital. And everybody's been really healthy. I just feel very strongly about having my children, especially Jack, who is the 2-year-old, wearing the mask. So as a general rule, I won't take all 4. Like, I went to Market Basket today, and my husband's luckily been working from home, so he can stay with the kids, but that's not always going to be the case.
Thank you.
Thank you.
Thanks.
All right. Well, Kelly, thank you again for taking time, and good luck with the kids.
Thank you.
I've been there. Good luck.
Thank you.
All right. Next, I'd like to recognize Andy Robichaud, please. You could. Good evening.
Good evening, Your Honor and City Council members.
Welcome.
I'm Andy Robichaud. I am a resident of Concord, and I have been working through this pandemic as a IT support person for grocery stores throughout New Hampshire and Vermont. I am not in favor of this ordinance, and the reason why is because I've been spending the last couple of days going through the data and preparing a table that shows when states instituted their mask ordinances compared to how their cases and death rates are changing. I've used the data from Bing, which is run by Microsoft, and they get their data from the CDC and the WHO. The first case I want to bring you to is Hawaii, which had a mask ordinance in place since April 17th. And from late March to the end of July, we're doing fine. And then the virus came to the island, and they have seen a surge despite having a mask order. The second case is Texas, which one of the callers talked about earlier. Their mask order went in place in July 3rd. From early April till the end of June, they had a fairly low rate, and then from June on till now, they've had another surge of cases despite having a mask order. I think that the mask requirement should be up to the individual businesses. I believe they have the right, as Jason said, it's private property. No shirt, no shoes, no service. Well, if the business owner feels no mask, no service, I think it's their right. At the same time, I think business owners should also have the right to not require masks. The fact that people are going to be penalized for this, I know everybody's talking about the science is there, the science is there. You can look and see what the trends are and how states that have mask orders, their numbers really aren't any different than states that don't have mask orders. New Hampshire has been decreasing since probably about the end of May. Our rates have been leveling off pretty good. We had a sharp increase from the end of March till the end of May. So I don't see the point of a mask ordinance at this time. I think it should be left up to the individual business owners. So, and I'd be happy to send you guys my table. I'll send it through the clerk if anyone's interested in seeing it.
Great. That'd be great. I appreciate that. Thank you.
Okay.
Anybody have questions? Seeing none, thank you for taking time tonight. Appreciate it.
All right. Thank you, sir.
Next, I'd like to recognize David LaRue, please.
Hello, how are you doing tonight?
Wonderful. How are you?
I'm doing excellent. Thank you very much, City Council, for having me on. I'm calling in from Cantor, New Hampshire. I do travel up and down the state quite a bit, and my wife is currently coming down to Concord Hospital for her nursing clinicals. So we do go in and out of Concord quite a bit, and I previously lived in Concord for about 3.5 years before moving up here. So I like a lot of what's been said, and I understand that you guys do need to address this issue, and there's been good commentary on both sides. But I wanted to bring to your attention some things from the broader scope across the world. Nothing happens in a vacuum, and I think we have a lot of examples of places to look for what happens a month or 2 months or 3 months after a masking ordinance, and what happens with the population and with the enforcement of this. There's a quite widely spread video coming out of Australia where a quite large law enforcement officer basically takes a much smaller female down to the ground by her face and her neck and holds her and they cuff her because Australia has a masking ordinance. Well, it turns out that after this event, this woman was following all the rules. She had an official exemption, a medical exemption, and it didn't matter. Over enforcement or improper enforcement or enforcement unequally can and will happen when you have something like this. So that just goes to the example that you can have somebody who's trying to play by all the rules, and the things can still go wrong when you put point of law enforcement behind something like this. So that's the enforcement. Now, also, there's been a video going around where a couple was sitting in a park eating their food at a table, and another bystander walked by and sprayed pepper spray on this couple because she was so upset that they were not masking. These masking ordinances do create division. Several people have talked about the fact that, well, I feel uncomfortable with a mask on. I feel uncomfortable without a mask on. Mandates like this only create more division. And when you legitimize putting any random piece of cloth over your face as an effective means of stopping a novel virus that we really have no control over, I think it only does more to divide our state. Now, Concord is the capital of New Hampshire, and it was already mentioned, our great General John Stark, our live free or die motto. I think it is important that Concord leads New Hampshire, and I think you guys need to set the example of liberty and freedom in this state. And I will use the current hospitalizations in New Hampshire as my real data to back this up. Currently, we have 6 hospitalizations from the New Hampshire.gov COVID-19 dashboard. We have 6 hospitalizations. New Hampshire has about 1.38 million people in the state. As of yesterday, we had 7 hospitalizations. As of about last Friday, we had 9 hospitalizations. Why do we need to start this now? It was mentioned by another person, ordinances for things that may happen, right? We don't arrest people for something they may do in the future. We judge on action, we judge on real things, not on possibilities. And I think the last thing I want to say is that if you look at the data in New Hampshire from this same chart, the New Hampshire laboratory confirmed COVID-19 cases, we always talk about the children and we talk about our elderly and our at-risk population. I would mention that all of these people who are not in support of the ordinance, they likely have elderly parents, grandparents. We are not coming from a place of malice, and we do also have people in our families who are at risk. But we recognize 2 things that we can see off of this chart. One, in New Hampshire, under the age of 40, we have lost 1 individual to date. This is not in 2 or 3 weeks from COVID. This is almost 6 months into lockdowns. We have lost 1 person under the age of 40. Likely they had other comorbidities and they had other health risks. So we see that really the children, the young folks, somebody who's otherwise healthy is not at risk of this. Now, for the older folks, we can also look to the division between healthcare workers and long-term care settings that is in this chart. Now, percentage of deaths for long-term care settings is over 81%. That's terrible, but what does that tell us? In the long-term care setting, who do we have? People who are already at risk of everything. People who already are sadly reaching end-stage life that are able to be kept alive and have extended years due to modern miracles of medicine. But they are the at-risk population. They also have been locked down. The staff has had to mask constantly since March. The staff has their temperatures taken. They have been isolated. People have not been able to see family in long-term care settings. Some of you probably have family in long-term care settings that you still cannot go see. With 2,169 infections in long-term care settings, we had 351 deaths for a rate of 81.3%. Healthcare workers, the table shows 1,749 people, and we had 8 deaths, 1.9%. Yes, this is an infectious virus that is novel and can be transmitted. But to get herd immunity, we need transmission and we need cases. And really, this virus is not much different than any other virus that we have had to deal with and any other risk in our world. Freedom is not safe, the world is not safe, and unfortunately, all of us will die. And I do not believe that you can strip people of their individual rights and force them to do things and make medical decisions with their bodies without really considering the backlash that will happen. I really, really think that needs to be looked at. There are thousands and thousands and thousands of people who are marching in Ireland right now against this. There are thousands of people all over the world, not just in the States, but we have other examples to look to.
Thank you very much. Really
You're
appreciate
welcome.
it. Really
And that's all data driven, and I really think you guys need to look at the data.
Thank you. That's great.
You're welcome. Thank you. Have a good night.
Alrighty. Next, I'd like to recognize Serena Barley, please. Good evening, Serena.
Good evening. Thank you for having me, Mr. Mayor and council members. I also agree with the last caller on a lot of issues, and I think some things that haven't come up a lot that concern me are the impulse to control people and what it is that they stand for. A couple of people mentioned that we wanted Concord to make a statement. And I guess that really gets to what most concerns me about this. Somebody said that, and I agree with this, that businesses can make the decision to require people to wear masks because they have that, because it's their business. But it's very different when the government makes that decision for people. And the question was, well, what's the difference between requiring people to wear shoes and shirts and requiring people to wear masks? And couple things with that. One is shoes and shirts are required by stores usually. So that goes back to the right of a store owner. But also, when we talk about requiring people to cover their mouths and noses, that is to me, represents speech and how we present ourselves to the community. So it's much different from saying, hey, you have to wear shoes. And my other concern is that I'm really concerned about where the end is. Mr. Potter mentioned that this could go on for a year, the gray area. And in the ordinance, it mentions it will continue until January and then maybe will be extended after that. So I'm also concerned about once we put something like this in place, when will it end? And what will be the standard? As other people have pointed out, that we have very low cases. So what's to stop us from doing this in the future and just requiring people to always cover their faces? And then I agree as well with the concern about police enforcement. How are they going to, I feel like they're already burdened, and for them to have to stop people and check their masks and then fine people, I just feel like you're getting into an area that is really interfering with people's freedoms and how they present themselves to the world. And just as a practical matter, this is something that has not come up, but I avoid shopping in stores that require masks. And I know a lot of other people do too. I don't want to wear a mask. But I don't want to offend people either. So already I feel like our businesses in Concord are suffering from this experience. And I'm concerned that this is just going to make it worse. And finally, I would like to point out that Concord is doing great. It's a great city, has a great community, and I really think we need to trust adults in the community to make their own decisions. I think it's an ordinance in search of a problem. I feel like we are doing well. We're living together. People disagree, but we're all getting along, and I think we're doing very well. So I guess that's the end of my comments.
I really appreciate you taking time this evening. I'm going to assume you live in Concord, or where do you live?
Oh, yes. Sorry. I live in Concord.
All right.
Yep.
Great. Thank you for taking time tonight. I appreciate your sharing your thoughts.
Okay. Thank you.
Actually, I apologize. Hold on. We have a question, and the question is from Councilor Fennessy, please.
Thank you, Mr. Mayor. Thank you, Ms. Farley, for joining us.
Thank you.
I'm just interested in your thoughts. You mentioned how we're doing well right now, but Mr. Potter raised the possibility of making this ordinance sort of contingent on us continuing to do well. What are your thoughts with respect to that? Would you support having a trigger point where this ordinance could go into effect?
No, I don't. I mean, I guess I would rather see coming to a point later and saying, hey, look at how much the world has changed. Let's go back to this. I don't like the idea of triggers because, as I said, I'm concerned about a new level of control of our citizens that can just be triggered anytime. So I would prefer that people be able to consider it in the future if the situation changes.
All set? Okay, thank you again. I really appreciate you taking time this evening.
Hey, thank you.
This time I'd like to recognize Jennifer Brayton. Good evening.
Hi there. Sorry about that.
No, welcome.
Thank you very much. How's everybody doing tonight?
Great.
Excellent. My name is Jennifer Brayton. I'm from Chichester, New Hampshire. I moved here about a year ago with my family. I came from the great state of New York, from the upstate region. And basically, I fled New York with my husband and our children because I was very fearful of the tyranny, honestly, that seemed to be spreading throughout our government. And it was not a place for conservatives. It was not a place for people who did not think the same as those who were in power. That being said, we came to this state, the live free or die state, to sort of escape all of that and live out our beliefs. My opinion on this is that if a mask works, then why not leave it to be optional for the people to choose for themselves whether or not that is something that they want to do. If somebody is immunocompromised, if somebody is elderly, if they have underlying health conditions, the option is obviously there for them to wear a mask. So if we have no seatbelt law, no helmet law, and it's basically optional whether or not you would like to wear a mask, why not leave it at that?
Okay. Anything else you'd like to add?
I think that's it. Thank you very much.
Perfect. Thank you for your time tonight and sharing your thoughts with citizens of Concord, and welcome to New Hampshire.
Thank you.
Okay. With that, we'll go to Lydia. Good evening. Welcome.
Thank you. My name's Ladea Irwin. I'm a resident of Concord on Warren Street.
My apologies.
That's okay. It's an unusual name, I understand. I would like to thank you, Your Honor, and City Council for letting me speak tonight. The reason I wanted to talk tonight is because I feel like there are some misconceptions about what masks do among the populace and the people who have been speaking tonight. Masks are better at protecting other people than they are at protecting yourself. When I go out and I wear a mask, it's a sign of respect to everyone else because I don't know if I am a carrier of COVID-19 or not. At any time, I could be infected and not be showing symptoms, and therefore wearing a mask protects everyone I come in contact with more than it protects myself. When I wear a mask, when I go into a store, what I'm saying to the people there is that I respect your life. I understand as an employee, you don't have the opportunity to make these decisions as to who comes in your store, who wears masks, and you can't always just quit your job because maybe the owner of the store doesn't think people should wear masks. So that's a decision I make on my part. But what you can do on your part is make that decisions for these stores to help protect the employees and the citizens of Concord and of New Hampshire who, again, don't have the opportunity to make those business decisions that their owners of the business are making for them. Another thing I'd like to say about the American with Disabilities Act is that it doesn't allow people with disabilities to just go into stores without wearing masks if they say they have a disability. What happens is they are given the opportunity to have accommodations made for them. So maybe someone in the store will shop for them, but that doesn't mean that they'll just be allowed to go into the store without a mask. So I just would like to point that out, that the Americans with Disabilities Act, the ADA, would not stop stores from keeping people out who are not wearing masks. And I think it's really important that we do this now and not on a trigger, because we can see from other states that, for instance, Bike Week happened and people came back to New Hampshire. There were 6 people who were infected from the Bike Week that came back to New Hampshire with COVID-19. And COVID-19 can stay in your body for 2 weeks without you showing any symptoms. So you could be spreading it without knowing. If we do this on a trigger, we may be too late. We'll already have seen that spike, and we may not be able to control it until after it's happened. So I think putting that trigger on the ordinance is a bad idea. Thank you guys so much for letting me speak tonight, and I hope you guys will make the right decision. Thank you.
Thank you very much. Appreciate you taking the time. Seeing no questions, again, thank you so much. Appreciate it. We now have Aaron Burchett Monroe, please.
Sorry, my dogs.
Good evening.
Yes, Aaron Frack Monroe. Rolling down on Short Street in Concord here, where there's a large truck rolling down the street. And my dogs are going crazy. I'm sorry about that, Mayor and council members. I'd like to reiterate what the last caller said about the trigger. I've been following David Brooks's column as well, and his triggers are that rolling 2-week data here. And I think we know that in 2 weeks a lot can happen, and that the cat is out of the bag at that point. So I'd like to see the ordinance stay more as it's written without any triggers, and possibly triggers used even to go another step if possible, if those numbers increase again. Thank you.
Thank you. Appreciate it. Is there any questions? I'll just say that since I live around the corner from you, I hope that's not one of my cats making your dog bark. So seeing no questions, thank you so much. Appreciate you taking time tonight. Okay. Believe it or not, I do not have any other folks looking to testify. Mr. Bahia, do you have anybody?
Nobody else, Your Honor.
Mr. Bahia, your voice got deeper. Okay, so seeing no one else, just wait a couple seconds. Make sure.
We have a new person, Your Honor.
Yep. Angela. Good evening, Angela. Welcome. Angela, if you might just tell us your last name and where you're calling from, be great. Angela, welcome. Angela? Okay, why don't we try moving on to Kevin Noyes. And Angela, if you can hear me and you want to come back, you're more than welcome. Mr. Noyes, good evening and welcome.
Thank you, Mayor, and thank you, City Council, for taking a few minutes to hear my words on this matter. I served this country in the United States military, as did many of the people who have spoken here tonight, I'm sure, and probably some of you in the City Council as well. I would like to make this kind of simple. I fought for the freedoms of this country. I didn't fight for this country to sit here and take them away. You want to take them away? You're going to lose my business and everybody else's business from us up here in the North Country who travel through your great city. So that is all I have to say about the matter. And believe me, this is being noted very well throughout the North Country. What passes down there will not pass up here.
Okay, well, thank you. Mr. Noyes, where in the North Country are you?
North Conway, New Hampshire.
North Conway, all right. I'm from North Country as well, so.
Thank you, Mayor.
No problem.
I appreciate that.
All right, thank you so much. Anyone else? Okay, I have 1-802-309-8390. Good evening and welcome. If you mind just telling us your name and where you're calling from, that'd be great.
Yeah, hi. This is Angela Mason, and I'm in Concord.
Hey, welcome back.
Hi, thanks. I connected through my phone, so a lot of good points were made in this meeting, and I just want to throw out some other things that weren't necessarily mentioned. I hear people saying that they're afraid to go into stores where there are unmasked people, and that if people don't want to or can't wear a mask, then they should use, drive-up services that retailers offer. Well, I would say, if you're afraid to go into a public place with unmasked people, why don't you use those services? That's an option for anybody to use. And it shouldn't be, narrowed down to just people who can't or don't want to wear a mask. On that note, retailers already have a choice to mandate masks in order to come into your stores. I don't see that mandating masks in a retail setting is going to have any sort of logistical or preventative effect at this point. You're still going to have people going to restaurants where they're eating, where they're, potentially coughing germs all around and spreading a virus. Why does a retail setting make any difference? How is that a more dangerous place than being in a restaurant? Further, touching on Lidea's comment about showing respect by wearing a mask, I would never ask anybody to wear a mask to protect me. If you want to wear a mask to protect yourself, that's your prerogative. If you feel unsafe in the general public, then you stay home. You're not necessarily a carrier. If you're asymptomatic, there has not been solid research that says that you are going to spread anything. Quite the opposite. A mandate isn't going to get people to comply. If people can't or won't wear a mask, they're not going to. It's virtue signaling. It's symbolic of, oh, we're all in this together. Do this for your neighbor. It's purely theoretical. There is not solid evidence that says that masks are protecting anybody. And if everybody needs to wear a mask to protect everybody else, it still doesn't work because particles are getting through. They're smaller than what everybody's wearing, which is the cloth masks. They're reusing the disposable ones over and over, so germs are accumulating, and those people are breathing in those germs, and they're getting themselves sick. It's not preventing anything. Concord has such a low incidence of COVID. This proposed mandate seems arbitrary at this point. Why now? Why didn't you do it back in March? We don't have a statewide mandate. I don't see how a citywide mandate is going to help anything. People get together in their private homes. They have social functions. Don't you think that would be a higher transmission likelihood than going to a retail setting? As far as having children 2 and over wear masks, I will not put a mask on my child. I have 2 children. I'm not going to teach them that they are sick until proven healthy. That is not the way that I'm raising my children. It's not scientific, and the populations that are at risk there are so many options for them to be proactive in their self-care that it doesn't require a mask mandate, which is essentially ineffective.
Thank you very much for taking time tonight. Appreciate that. Does anybody have any questions? Seeing none. Again, I'm sorry about the technical problem, and I'm glad you called back in, and thank you for sharing your thoughts.
Thanks for listening.
Thank you. At this time, I'd like to recognize Matt. Good evening, Matt. Welcome. If you could just tell us your full name, and Matt, if you could just tell us your first name or your full name and where you're from, that'd be great, and share what you're thinking.
Yeah, I'm Matt West. I'm from Concord. Lived here my whole life. Okay, for one, the CDC alone just updated their own data showing that only 6% of the deaths were from COVID-19 alone, and the other 94% are from people that had underlying health conditions already. For two, unless you've actually taken an OSHA 10 safety course about masks, you really have no clue. Cloth mask is not going to stop anything. If when I paint, I have to wear a full face respirator, or when I'm doing asbestos, I have to wear a full face respirator covering my eyes and everything else and all your other mucous membranes, a cloth mask is not going to stop a virus. Simple as that. It's just a placebo effect and a way to get people to duck and cover. It's completely unreasonable, and you have too many people with underlying health conditions that cannot wear masks. They either have asthma or other problems. And then if you actually take the time to study what the long-term effects of wearing a mask can do for you, it can cause all kinds of staph infections, which a bunch of people have been reporting across the US since they've been forced to have to wear one. It's completely ridiculous. Forcing people to do something like that, that's trying to find the right word and be polite. But asinine is what's coming to my mind.
You know what, Mr. West, I think you don't need to. I think we found that word for you. We got it.
Right.
Thank you again. Anybody have any questions for Mr. West?
I don't know. You guys really, really need to think and go take an OSHA 10 safety course on masks. Have a nice night.
Thank you. Appreciate it. Next, I'd like to recognize Susan. And it appears Susan's no longer there. Or is she?
I believe Susan went away, Mr. Mayor.
Okay, thank you. I see further. Then I believe at this time we'll close the public hearing. And again, thank you to everyone who took the time to share your thoughts this evening. So at this time, being 9:07 and we've been here for 2 hours, I'd like to take just a 2-minute break, if you wouldn't mind, please, and we'll come right back. Thanks. Okay, if we could all come back, please. Okay, I'm trying to figure out whether we have everybody, and there's a couple people that don't have their cameras up, so I just want to make sure they're back. Councilor Fennessy, are you with us? While we're waiting for Councilor Fennessy, there we are. I'll just note one last thing on the attendees. I do have one person named Susan who has her hand raised. Susan, I apologize. We closed the public hearing for this evening. We put a good 2 hours and 10 minutes in, so sorry I didn't see you weren't recognized earlier, but thank you for listening. So with that, Madam Clerk, if you could read the item number 4, the hearing public action.
It's an ordinance amending the Code of Ordinances, Title I General Code, Chapter 13 Public Health, Article 13-4 Vaccinations and Communicable Disease by adding a new section 13-4-14 entitled Wearing of Face Coverings in the City of Concord, COVID-19.
Thank you. Before we take a motion, could I get a motion to move the supplemental ordinance in front of us so we could start with that?
So moved.
Second. All right, moved and seconded to make it clear that we're taking out the supplemental ordinance. For any discussion, seeing none, Madam Clerk, if you can just call the roll, please.
Councilor Bouchard.
Yes.
Mayor Boulay.
Yes.
Councilor Champlin.
Yes.
Councilor Fennessy.
Yes.
Councilor Grady Sexton.
Yes.
Councilor Hatfield.
Yes.
Councilor Keach.
Yes.
Councilor Kennison.
Yes.
Councilor Kretovic.
Yes.
Councilor Mattson.
Yes.
Councilor Nyan.
Yes.
Councilor Pierce.
Yes.
Councilor Rice Hopkins.
Yes.
Councilor Todd.
Yes.
And Councilor Warner.
Yes.
Thank you very much. So we have the supplemental ordinance in front of us. We do have to do one other thing, parliamentary-wise. We have to waive Rule 4, which is basically, I believe, second reading, so we can take an action one way or another on this tonight. So as the Mayor Pro Tem moves that, seconded by Councilor Keach, that is to waive Rule 4. Is there any discussion? If there is, then Mr. Kennedy's going to have to explain it. But that is for parliamentary purposes. Seeing no discussion, Madam Clerk, you can call the roll, please.
Councilor Bouchard.
Yes.
Mayor Boulay.
Yes.
Councilor Champlin.
Yes.
Councilor Fennessy.
Yes.
Councilor Grady Sexton.
Yes.
Councilor Hatfield.
Yes.
Councilor Keach.
Yes.
Councilor Kennison.
Yes.
Councilor Kretovic.
Yes.
Councilor Mattson.
Yes.
Councilor Nyan.
Yes.
Councilor Pierce. Councilor Rice Hopkins.
Yes.
Councilor Todd.
Yes.
And Councilor Warner.
Yes.
Okay. Thank you very much. Appreciate that. So we do have, we are in the public action phase right now. We have a supplemental ordinance before us. We can entertain a motion.
I'll move approval, Your Honor.
Motion made to approve and seconded by Councilor Todd. Okay, we're open for discussion. Who'd like to speak? Councilor Rice Hopkins.
Okay, thank you. I did have one follow-up question for the city solicitor. I noticed that in our original draft, it talked about city buildings. Are we covered under the retail business portion of this now, or is there a reason that that has been removed? Thank you.
No, the city of Concord is not covered under the retail. And the city of Concord for public buildings would be subject to the city manager's authority to institute rules for the city buildings, as he's already done in accordance with Article 4 of the City Code of Ordinances.
Any further questions? Okay. Who else would like to speak? Anyone else? Councilor Rice Hawkins.
Thank you. I was going to give my other counselors a chance. I would like to consider lowering the age of children to, I would like for it to be 2 and above, but I would go with school age children, which I think is consistent with what some of the other communities have done. And also when you think about some of the school districts and after school programs and childcare centers is also what they're doing as well. I'd be interested to know if other counselors would be interested or supportive of that. As the mother of a 5-year-old and a 13-month-old, I can tell you that I say this with great faith in the ability of our children to do this, and also knowing that many children are going to be asked to do this in other settings, so to keep it consistent.
Thank you. So I have a couple of people raise their hand first, and we can come back to that. Councilor Champlin.
Yeah, thank you, Your Honor. I will just mention that I would support lowering the age to 5. I have my 6-year-old grandson was over yesterday and wearing his mask, and my daughter has been training him on that. So I think that that's a reasonable age. 5 would be reasonable. Your Honor, we've heard a lot of very solid and very impassioned testimony tonight. You know, what's interesting to me is that we've heard both tonight and, you know, what the people who have participated tonight haven't seen is the volume of emails that we've received that have been shared among the members of the City Council. You know, there are people who say that they feel that they have not been shopping in Concord because people aren't wearing masks in the shops. And we've heard tonight and in some of the emails that there are people who are saying, well, if you know, I don't want to wear a mask, so I won't shop in Concord if you make me. And I respect both of those opinions. What concerns me is this. We're entering into the fall season, which is preliminary to our traditional Christmas shopping season, which is very important to many of our retail merchants in the city. And I've talked to many of our retail merchants who have expressed, let me rephrase that. I've spoken to a few of our retail merchants who have expressed concern about what happens during the Christmas shopping season. That's a make or break season for our merchants. I'm very concerned with the personal safety of all of our citizens. As people have mentioned tonight, the loss of one life is a tragedy. And so if we can preserve those lives, I think we should do what we can as public officials to do so. On the other hand, the economic life of our city is really important as well. And so what I fear is getting into the winter season, the late fall and early winter season, and having a sudden spike that drives people away from our merchants and away from our stores over concern about the virus. So for that reason, you know, and it can happen very, very quickly, as I think Dr. Potter mentioned. I'd point to Millinocket, Maine, which a small community of 4,000 plus people, which had 0 cases of COVID-19 until a wedding and wedding reception where people, you know, were unmasked and did not observe social distancing. And the most recent reports that I've seen indicate that 123 cases of COVID-19 and 1 death have been directly linked to that one instance of people not wearing a mask, not staying an appropriate distance away from each other. And the person who died wasn't even at the event. It was somebody who came into contact with somebody who came into contact with somebody who had been at this event. So to reiterate, the last thing I want to see happen is to have us experience a sudden spike in October or November, when it's really critical for the city to have people feel safe and secure in coming downtown and visiting our retail merchants, which I think is what this proposed ordinance is designed to do. I'm very sensitive to the people who have expressed concern about personal liberty. I do understand their perspective. I think, though, that I agree more fully with the opinion that was expressed in a recent op-ed or opinion piece, rather, that I read in the Wall Street Journal a couple of weeks ago. The author wrote these words, which I think are pertinent. The right rules are a condition of liberty. Just as the blissful freedom of the road requires measures to pave those roads, and well-drafted anti-fraud statutes only fortify the free market, sensible public health policies like mask wearing rules, which protect both the individual and the commonweal, don't compromise liberty, they advance it. So for that reason, Your Honor, I'm very supportive of this measure and interested in hearing what my colleagues have to say. Thank you.
Thank you very much, Councilor. Councilor Mattson.
Thank you, Your Honor. I've been speaking to some of my constituents, and one in particular had given me verbal testimony, which they'd asked me to present a little bit. And part of the things that they're concerned about, and a couple in general, have been basically the enforcement aspect of the ordinance. They were particularly concerned about being more or less stopped by the police walking on a sidewalk and being fined at that particular point. The other aspect that they were talking about was they felt strongly that, you know, wearing masks did not help build up immunity for them. So I said that I would forward this information as well as the enforcement concerns that they had. And there were some others that were against the ordinance as well, with respect to, especially with respect to the ordinance aspect of it, and how that would play out with the police department. What I would like to say is, you know, with this, the trigger point comments that were brought up earlier, I find very interesting, and I actually wouldn't be opposed to considering that particular type of an aspect. And while I have some concerns about how the enforcement will play out too for our police department, and with respect to people who are not going to be compliant, if that's going to trigger more division, because it seems like it's such a polarizing issue for people. They're either strongly for it or strongly against it. And I do understand and see both sides. In this case, I will be supporting the ordinance, and if we can work with the trigger aspect, or if we can like as I said, the revised ordinance will actually be a little bit better for some of the residents. And I did try to assure my constituents that outside was not quite as wasn't the issue. It was really the inside retail. So thank you, Your Honor, and I appreciate the time.
Thank you very much, Council Warner.
Thank you. A little slow on the unmuting, but thank you. Yes, there was a lot of passionate testimony tonight. I will support the ordinance. I think that we need to protect public health. I would be very much opposed to the trigger idea. I don't think we ought to be waiting until things are evident or they need to be bubbling in some way. I just think that we need to be about prevention. That's one thing. This virus is out of control in other parts of the United States. It's spiking in other states. I don't want to see it spiking in New England. I don't want to see it spiking here. I'm afraid that if we don't take precautions, that will happen. And I think that anything that we can do to protect public health is what we ought to be doing. And I think we ought to have the most expansive ordinance possible. It's really what it's all about, as far as the bottom line, as far as I'm concerned. So I will be supporting the ordinance. And I want to thank the members of the committee that worked so hard to fashion it. There's obviously a lot of legal negotiation and factors to consider. So thank you for your efforts. And look forward to the continued discussion with my colleagues.
Thank you. Councilor Kretovic, please.
Thank you, Your Honor. I find it very interesting, and Councilor Mattson, thank you so much for bringing up the issue with regards to enforcement. It doesn't slide by that some 2 months ago, we were sitting here as a council receiving over 100 emails for people asking us to defund the police within our city budget and to turn over those dollars to social services so that they could be more responsive to people that are in a mental health crisis, to people that are have been assaulted or other issues. And that came to the forefront over issues regarding Black Lives Matter and suggestions that community, our police department was targeting people of color or Black people. And yet here we are 2 months later, and we're trying to put our police in a position where we will target people who are not risk, regardless of their color. I do find it interesting that we've heard several times from Chief Osgood in reports in the newspaper with regards to enforcing the regulations set forth by the governor, that when there are complaints, there actually is no enforcement that actually goes to this effort. Solicitor Kennedy had mentioned that this would either befall the police department to respond to on a complaint by complaint basis, or to the code enforcement agency, our court enforcement office with regards to public safety. And I'm curious, Mr. City Manager, Mr. City Solicitor, if you could tell us how exactly the enforcement piece plays out in this ordinance here in the city of Concord. And is it truly by the fact that someone will call and complain and a police officer will knock on someone's door, go to the establishment? How exactly does that work? And I would appreciate a clarification. Thank you.
Mr. Kennedy?
Yes, Councilor Kretovic, as with any ordinance, it would be complaint-based, and it would be for the discretion of the police department to determine what is the appropriate level of enforcement, as is with the code enforcement department. And so to the extent that a retail establishment were to make a complaint, or there's some kind of complaint came into the city, it would be that department, either I suspect police or code, responding. I do see that we do have members of our police department who are attendees, and it may be appropriate for the police chief to respond to your question directly, rather than me offering, more of my understanding as to how it would proceed.
Thank you very much. Mr. Manager, could you please bring in Chief Osgood, please? Mr. Manager, are you bringing in the chief? There we go. Thank you. Chief Osgood, did you hear the question?
I did. Am I unmuted?
You sure are.
Yeah, so I think that any complaints that come in, especially Monday through Friday during normal business hours, would be directed to the Code Enforcement Division. And anything after hours, we can certainly respond to as necessary.
Okay, thank you. While you're still here, does anyone else have a question for the chief? I have both City Manager and Councilor Champlin raising their hands. Mr. Manager, you want to go ahead? I saw you first.
Certainly. So check your volumes. So to put that in perspective, we have one health officer and one health inspector, and to cover the entire city, and the workload associated with both of them is more than they can handle, given the inspections of all the restaurants and whatnot. So just to put it all in perspective.
Thank you very much. Mr. Councilor Champlin, please.
Thank you, Your Honor. Chief, thanks very much for being here. Would it be fair to say that that if this ordinance were to pass, that we would not be seeing policemen roaming up and down the streets of the city, looking for people who aren't wearing masks?
That's correct.
It would only be if there was a complaint filed.
And the complaint would need to be someone who would have to leave their name. We're not taking anonymous complaints.
Very good. Thank you. Thank you, Chief. Thank you, Mr. City Manager.
One more time. Any questions for the chief before he leaves? Councilor Pierce, did you have a question for the chief, or did you want to speak?
A question of the chief.
Okay.
Thank you, Chief. Thank you, Mr. Mayor. Chief, could you walk us through what this might look like? You've received a complaint. It's in a retail establishment, and an officer responds. Just walk me through that. What would that look like? And I realize it's speculation, but
Yeah, so certainly it's not anything unlike we're used to dealing with complaints and trying to mediate and resolve disputes. So essentially we would go and, as the ordinance suggests, is that really education is first and foremost here. So when we do make contact with individuals that are in violation of the supplemental ordinance, we would educate them as best as we can. We would document our encounter with them so that, in the event that, 7 days later we receive another complaint, maybe at a different retail establishment, that we would be able to at least go up to the next level of the ordinance and issue that first level fine. So yeah, we wouldn't be necessarily taking a proactive approach, running to Home Depot and doing compliance checks necessarily, but certainly if those calls came in that employees at a certain place were not wearing masks, which we've done with restaurants and other venues in Concord, we would do spot compliance checks.
Was that okay?
Follow up, Mr. Mayor?
Yes, please.
And I don't know if it could be for the city manager. What would it look like with code enforcement responding to the same call?
If because there's one full-time and one part-time health inspector, it would depend if they have on a call. If they're on a call, then they would follow up at a time that they can make themselves available. And then the procedure would be exactly the same. It'd be an education process. And then the last resort would be any type of fine.
Okay, thank you very much.
Councilor Hawkins, did you have a question for the chief?
I did, either for the chief or for the city manager. We heard some questions tonight about the health exception, and I was curious if you could tell us how that would be handled if somebody cited that.
Yeah, so that's an interesting question because they can cite it, but I don't know if they're going to have documentation necessarily on their person to produce to demonstrate that. So we would certainly take it on its face that they do have the health exception during our initial contact.
Thank you.
Okay. Thank you, Chief. At this time, I'll recognize Councilor Hatfield to speak.
Thank you very much, Your Honor. I will be supporting this ordinance. If you look at the CDC website today, it says the CDC recommends that people wear masks in public settings and when around people who don't live in their households. And I agree with a lot of the commenters that it really is something that we're doing for other people. And New Hampshire has one of the lowest infection rates in the country. And I really believe that we should be doing everything we can to keep it that way. So thank you.
Thank you. Councilor Knight.
Yeah, thank you, Your Honor. The risk of trying not to regurgitate all the testimony we heard this evening, I certainly agree with the fact that people should wear masks. It's the right thing to do. It's a good way to protect, I believe, both ourselves as well as those around us. I also believe we heard a lot of compelling testimony about personal freedoms, and that extends out as well to, as Councilor Champlin said, people who have expressed, I won't shop in your businesses if I have to wear a mask. Others saying, I won't shop if I do have to wear a mask. So there's many, many different sides to this. One of the more compelling pieces of testimony I heard several weeks ago when we put this down for a public hearing, and then I heard it again mentioned this evening, is we as a city being able to assist our businesses in protecting themselves. For example, it was Councilor Keach who mentioned it several weeks ago, which is, as a business owner, it would be nice if there was an ordinance that he could point to when a customer entered the store and say, hey, listen, we have an ordinance that requires a mask, please mask it. It's some other additional measure that business owners can point to. I also believe that business owners should be able to run their businesses as they see fit. There may be operational issues that they want to address that wouldn't require masks. And I think one of the solutions that may benefit all is to have an opt-out clause in this particular ordinance. We can adopt the provisions, relative to age and children and all the other components, but to allow businesses the opportunity to self-identify, register with the city as a mask optional facility, which would then enable a business to post on each entrance to the facility that it's a mask optional facility, and we have some language that we could use for that, which would serve as a mechanism to identify to the public that if a consumer wanted to shop in the establishment, they did so knowing that others may not be wearing masks, they still may be wearing masks. It will also allow those who only want to shop in mask required facilities to enter those. It really puts the onus back on individuals for their own personal freedom to be able to shop where they want, to do what they want. I think it's probably the best solution to move forward, taking into all the different components. So I'll sit back and wait to hear others' feedback on this. I did submit to the council earlier this evening a draft amendment, which I'll speak to if necessary, but I'd like to hear some feedback from the fellow councilors first.
Thank you very much. Councilor Champlin, please.
Thank you, Your Honor. I didn't put my hand up to respond to Councilor Nyan. I put it up before he started speaking, but I'll just mention I do have some reservations about the proposal that Councilor Nyan makes. I worry that it might dilute the ordinance to the extent that it would be like not having an ordinance. And also, I don't know that it sends a consistent message to people, particularly people who now have to go around figuring out which stores they feel comfortable going into and which ones they don't. But again, I'm interested, as Councilor Nyan is, in hearing other councilors' opinions. The reason I put my hand up, though, was there's something that Chief Osgood mentioned, which was pertinent, and it's something that we discussed last week. He mentioned officers' first step being to educate. And I think the last time we met, not last week, but at our last meeting, when we set this for public hearing, we had talked about the need for a public education program to go hand in hand with any ordinance that we might adopt, so that really the ordinance can act as a kind of a focal point of a broader public education effort. And I just wanted to ask that not be forgotten, and that we, in fact, the city administration would use its resources to embark on public education as part of our effort. Thank you, Your Honor.
Thank you. Councilor Keach.
Thank you, Your Honor. To Councilor Nyan's approach, I would support that. I mean, personally, as a business owner, I would probably require masks in my business, but I do understand and respect that option of an individual business making that decision for themselves. So if a customer is not comfortable shopping in that store, then please don't shop there. But I do like that sort of individual liberty part of it. So I would be supportive of that modification.
Councilor Kennison.
Thank you very much. I would not support that modification. I agree with Councilor Champlin that it would really water down what we're trying to do, and it'd be very confusing. I just could not support that. Thank you.
Thank you. Councilor Todd.
Thank you, Your Honor. Yeah, I will also try hard not to repeat things that have been said already, but I do also want to thank, as others have, our city solicitor and the members of the committee for their hard work on this measure. I've certainly heard from folks on both sides of the issue, like we heard tonight. And I want to thank everyone that reached out to me to give me their opinions. More folks seem to be for some kind of an ordinance than against. And certainly I've heard from some business owners in Ward 1 who would like to see the city back them up with regard to mask wearing rules that they've already imposed or that they would like to impose. So I'll be supporting the ordinance because of the importance of public health and safety. But I would like to stress that this measure has everything to do with public safety, and in my opinion, nothing to do with trying to make a political statement. I'm not interested in making a political statement. I'm interested in my obligation to serve my neighbors and the public, and do everything I can, even if I might not like it, even if I might think it might be a little bit unfair or unjust. But to ensure their safety, I think it's important. Potentially, saving lives is probably the most important thing that we could do, I would think. Just as we would break a no swimming law and dive into the lake to save someone who we might think is drowning. So can I anticipate how many lives will or might be saved through this? No, but I don't know if that really matters. And I don't know that it should. It should matter, I think, how much effort we all put in to try to do something that we think will help people. I also kind of agree that I don't really see that there's a big deal with putting on a mask. The problem that we have, though, I think, is that people are not all uniform in making the same judgment or decision about these things. Seatbelt laws, as I think was pointed out tonight, and helmet laws protect you, but masks, obviously, from the science we're getting, protect others around you. And I certainly appreciate the folks from the military who called in tonight. They were asked by our country to serve, to protect us, and they took that call. And now I feel we have a different need to protect our community, and our country and our community is asking folks to join in this cause. And it's not giving up liberty. It's just the opposite, in my view. It's joining together to do whatever it takes to fight this enemy virus and to defend those among us who may not be able to defend themselves, those who are more at risk. It's really no different than folks being asked to dim their lights during World War II air raids. So maybe there are some out there who would make this a political issue, but I don't think the council, in my opinion, is doing that. I don't want to do that. New Hampshire right now is about 5th from the bottom in the number of confirmed cases, according to the CDC data. It's something like 7,500 cases, and there are less cases reported in a few other states, Alaska, Wyoming, and our neighbors in Maine and Vermont. But there were other states with low case numbers, the Midwest, for example, that are now seeing tremendous surges in areas. And so this is what I call preventative medicine. The New Hampshire advantage that we have here with this is that we don't have a dense population. But that alone, I don't think, is going to prevent an upsurge of this virus, which has proven to be very powerful. And I would just want to add that, as I was saying, this really is about safety. And just one final point on the ordinance. No one has discussed this quite yet, but if we compare this to motor vehicle safety, for example, there are reasons why if you get caught speeding, you're going to get a fine, and most likely without a warning. But again, that's up to the discretion of the police, and that fine will be significant if you're caught speeding. And the reason I think for that is that speeding endangers not just the speeding driver's life potentially, but also all the other drivers around sharing the road with that driver. So this would be as opposed to a parking violation where you would receive a much lower dollar fine that would be commensurate with the nature of the violation. So as we have proposed here now, the fine associated with this ordinance is the equivalent at $15 of a parking violation. It's not really in line with something that I would consider public safety, which would be more of a speeding violation. So certainly if you were caught parking in front of a fire hydrant, that would be a more significant fine, perhaps even towing your vehicle. Again, in line with the safety aspect of it. So I'm just not sure if we're sending the right message to folks that is it too much of like a wink, like, yeah, we have an ordinance, but no worries, it's only $15. I think that considering that this will be difficult to enforce, as we've already heard this evening from the chief and the city manager as to staffing and enforcement, that we're really looking more at something that would be a good deterrent factor and that might influence behavior that way. Deterrence, that seems to me, is going to be an important element along with education, especially for those who might be out there who are kind of on the fence and just need a little encouragement to do the right thing and wear the mask. The government's recommendations, though not enforced, I think they're quite thorough, and I think if we're going to enforce, it should be with meaning. We can certainly make the statement as proposed, but I don't see it as being quite as effective. Conservative, I think, was the way Ms. Correll described it tonight, or as Mary Deal said, how can we give it more teeth? So certainly something is better than nothing on this issue. As I said, I'm going to support. And we ultimately, I think, just want to send a message that public health and public safety are important to us in our community. Thank you.
Thank you. Council Pierce.
I have a question and a comment. First of all, the question for Councilor Nyan, if he's willing to take it. I'm intrigued by the idea of his amendment, but I wonder, as he was explaining it, if you make this optional for retailers, isn't that something they could do now? And if so, what would the need be for this ordinance?
Yeah, thank you, Councilor Pierce. You know, it's really an opportunity. When this first presented itself as a business issue, it was being able to point to a city ordinance that had perhaps some teeth, not many, that a business owner could use to say to a member of the public, you really need to put a mask on. It's not just me, the business owner, making this up, but it's something that the city has passed. The opt-in component is really designed to recognize that some businesses may not wish to do that. It may not be right for their particular business. You know, we just heard from Councilor Todd talk about, this is an absolutely toothless ordinance that we're going to pass this evening. There's absolutely no penalty provisions whatsoever, whether it be $15 or $5,000, we're not going to enforce it. So what we're doing is we're coming up with this panacea of telling the public, we care about you, but we're not going to enforce it. How's that any different than really what we're talking about by making it optional? So I think, well, each and every one of us who has spoken has said that we believe in wearing masks, we believe in doing the right thing. We're really kind of, all of us, even myself included, talking about making it optional, are talking out of both sides of our mouth. If we really want to protect the public, put this thing in place and put a hefty fine on it. Otherwise, I think what we're really trying to do is to strike a balance with regard to our concern for public health and public safety, as well as that balance with those individual freedoms, and recognizing that some business owners may wish to conduct their business differently than others.
Thank you. Comment?
No, I think I'm going to hold my comment. Thank you.
Thank you very much. Councilor Rice-Hawkins.
Thank you. Councillor Todd took a little bit of what I was going to talk about, which is that this is a very patriotic thing to do. It's a very low-level ask that Americans are being asked to do to help protect their neighbors and their loved ones, and I'm glad that the City Council is looking into this tonight. I think it's also really important because this is a public health issue and we don't want to make it political. It is really critical that it be a city-wide ordinance. We don't want a patchwork, and frankly, that's what we've seen at the federal and state level that has kind of led us to this place where we're having the discussion tonight, and several other municipalities or states having to go through their own deliberations. I also wanted to thank Councillor Kredovic for bringing up Black Lives Matter, because I think one of the things that's true is that racial disparities exist in healthcare, and COVID-19 has really laid those bare in a more prevalent way than I think folks had realized in the past. And we know that that's true, that there are communities who are disproportionately impacted by COVID-19 and the spread, whether it's racial inequity or older individuals, those who are low income, those who are immunocompromised, or frankly, anyone with a job who needs to go into work, who's nervous to be in their place of business because they may have to wear a mask, but the customers they're interacting with and the folks who should be on the other end trying to protect them as well do not have to. So I really support this ordinance, and I think that it's really critical that we have it in place in Concord. I do want to note that I have considered deeply how to get around the health exception piece, because I do have a little bit of concern that that will be misused by some individuals who simply do not want to help their neighbors by wearing the mask. And I think we've also heard a lot from small businesses who have some concerns about that as well. The problem is, when I've looked around at other ordinances, often they ask for a medical card or a letter from the healthcare provider advising not to wear that mask. And I think going back to inequities, not everybody has a healthcare provider that they can go to get a letter like that. And so I'm just going to acknowledge that that's not an ideal situation, but it is something that I think we did hear some concerns about. So I want people listening in to know that we did consider that. And unfortunately, there's just not a really good answer there. And we have to trust that people make good decisions. And I hope people will. Thank you.
Thank you. Council Bouchard.
Thank you. Make sure I'm done here. Thank you. I will be supporting this ordinance, and I do not support the opt-out because I think it weakens it and just makes the whole ordinance, it just weakens it. And I do support lowering the age to 5, I think, to be consistent with what children are doing as they're going to daycare and school. But I think too, we got to look at this. This is, yes, a public health effort, but it's also an economic effort. Our economy has crashed due to the pandemic. And if we want to build our economy back up, we got to make sure we don't go backwards. And I think the best thing we can do, and what we're being told by the CDC, is to wear a mask. And as Councillor Hatfield pointed out, they just updated their website as of August 27th and have a whole section on the update is on how to wear a mask and how to pick out a mask. So to support our retailers and support those of our most vulnerable citizens and friends who want to go out and be part of the economy, I think the mask is the way to do it. And we're not wearing it for ourselves, we're wearing it to protect others. And I think that's the point that's been lost a lot with some of the testimony we've heard tonight. It's not so much I'm protecting myself, I'm protecting someone else that I don't know that could be at risk, or I might be sick and you might not know it because some people just don't show the symptoms. So for all of those reasons, for protecting our public health, for protecting our economy so we don't go backwards, and for protecting our other citizens, I'm definitely going to be supporting this ordinance. And as for law enforcement, I trust our Concord Police Department to be able to educate and to handle the situation as they do other situations when, we have people might not have their dog on a leash, and, just to handle this in a way where it's an opportunity to be educating the public. And I think we do have teeth. The first time is a written warning, then you get a fine. If you don't pay the fine, it doubles, and then in 20 days, it's even higher. So, and then you can end up going to court. So I think there's teeth in it, and I think this is a tool that will not only help our retailers, but it will help our citizens, and that we can all pitch in and do the right thing, public health wise, and to build our economy back up. Thank you.
Thank you. Councilor Fennessy.
Thank you, Mr. Mayor. To answer one of the questions that was raised by, I think, a number of the people making comments tonight, why now if we didn't do this in May? And from my perspective, the biggest reason to adopt something at this point is, unlike in May, when there was still a stay-at-home order in place and people were largely avoiding shopping plazas and going out to some extent, restaurants weren't open. People have been moving around for a number of months now. And with the return of at least some schools and people returning to offices. There's more and more people that are starting to move around the city, and some people have gone on vacations to other locations. So that's fine now while people are spending a great deal of time outside, but that's likely to change as the weather changes. And so, to the extent that we're going to take a preventative measure, I think now is an appropriate time to do it so that we can hopefully avoid the dreaded second spike that everybody's been talking about that we're likely to see this fall, and particularly this winter. Now, that being said, I do have some of the same concerns that Councilor Kretovic has identified. I know I've mentioned a few times now my concerns about what enforcement looks like. And frankly, from what I've heard, there's not going to be much in the way of enforcement. It doesn't sound like we've got the appropriate people doing it, and I have concerns about forcing our police officers to get into, situations with people who are going to be choosing to ignore the ordinance to prove some sort of a point. I previously suggested that maybe we should consider whether parking enforcement could enforce this ordinance during the week. It sounds like that might be a better option than relying upon code enforcement that has enough to do already Monday through Friday. So I would suggest that maybe we consider that as a means of enforcement if we really do want to put any teeth behind this ordinance. Certainly we've structured the penalty provisions much in the same way that we've structured parking. Perhaps those are the appropriate city personnel to actually do the enforcement of this. Just the last point with respect to Councilor Nyen's proposed amendment. From my perspective, I give Councilor Nyen a great deal of credit for coming up with a compromise. But from my perspective, if we're going to move forward in adopting an ordinance, I'm not sure why we would create an opt-out or an opt-in. That is essentially the current situation we have right now. And from my conversations with business owners and the comments that we've seen, they're really looking for the city to give them some backup here so that they can tell customers it's not just a choice they're making, but the city is mandating it. So if that gives them some level of comfort in trying to change behavior of people who want to go to their businesses, then I'm supportive of that.
Thank you very much. Councilor Pierce.
Thank you, Mr. Mayor. Though I am unburdened with any medical degrees, I do feel now that the medical community is wholeheartedly supporting the use of face masks where social distancing cannot be achieved as a way to reduce the spread of COVID-19. While I had hoped a sense of personal responsibility would negate the need for a face mask ordinance, I feel this issue is about respect, but rather than what some would call needless or first step regulation. I think this proposed ordinance strikes the correct balance of addressing those local retail issues not addressed by our government's reopening guidelines. As a matter of respect for those essential workers who are required to wear masks, I am willing to wear masks to protect them. I would be supporting this supplemental ordinance as presented.
Thank you. Councilor Kretovic.
Thank you, Your Honor. I'll apologize in advance. I'm a little cranky about this ordinance. I've gone back and forth over and over again for the past couple of weeks, even before we had the recommended ordinance in front of us. I've heard a number of constituents. I've read a number of different ordinances. I've gone to the CDC. I've listened to my doctor, and I just go round and round. I want to show appreciation for people that think that it's infringement on their rights and that it's just as scary to see somebody wearing a mask as it is to see other things. And it brought me immediately back to an incident on Saturday. I'm not one that goes to the grocery store. I have a husband that does that for me. And on Saturday, I actually went to the grocery store because he wasn't able to go. And there was nothing more frightening than the man not walking into the grocery store without a mask and carrying a gun. And I'm going to tell you, the gun was more scary than the person not wearing a mask. That being said, though, I don't think that this is something that we're going to be able to enforce well I do think that it is something that is necessary in our community. And as far as it being political, I think it's totally political. I would agree with what Councillor Pierce just said. This was something our governor should have put into play, and it's been passed down to our community. And if he won't stand up and be a leader, I think that we on the council need to do it because the community is asking for this. And for all the health reasons and for all the respect of those people that are out there, I'm going to support this as well. Thank you.
Thank you. Council 9, I'm going to come back to you. So we do have a motion. We do have pending before us. You have expressed an interest to listen to your fellow peers to see whether you want to offer an amendment. After listening to your peers, would you like to do that or not?
Yes, I move that we amend the ordinance to allow an opt-out for businesses. And if we get a second, then we can talk about language.
Is there a second?
I would second that. Councilor Keach.
Motion made and seconded by Council Keach. Okay, so we have an amendment before us. Does anyone wish to speak to that further? That is, I'll just say I'll be voting opposed to it. I appreciate the effort, and I think there's good intention, but for as many of the other people said, I think it just basically neuters the whole thing. And quite frankly, if you're opposed, then just vote opposed to the whole ordinance. I think it's just much simpler.
Can I get a roll call vote, please, Your Honor?
Absolutely. Anyone else? Okay, seeing none, Madam Clerk, if you call the roll, please.
We'll start with Councillor Nyan, since he asked for it. Councillor Nyan?
Yes.
Councillor Pierce?
No.
Thank you. Councillor Rice Hawkins?
No.
Councillor Todd?
No.
Councillor Werner?
No.
Councillor Bouchard?
No.
Mayor Boulay?
No.
Councillor Champlin?
No.
Councillor Fennessy?
No.
Councillor Grady Sexton?
No.
Councillor Hatfield?
No.
Councillor Keach?
Yes.
Councillor Kennison?
No.
Councillor Kretovic?
No.
Councillor Matson?
No.
Fails 2-13.
Okay, the motion is defeated. So with that, I will return back to Councilor Rice Hawkins. You had talked about potentially offering an amendment. Now's your time if you wish to do so.
Thank you. I'd like to move that we amend the ordinance. I'm just trying to find the spot in here.
Number
There we
five.
go. Number 5, I propose we move amend the ordinance to say that it shall not be required for children under the age of 5 years old. Or under 5 years of age.
So you're striking 10, replaced with 5, correct?
Yep, thank you.
Thank you. Is there a second?
Second.
Motion is made, seconded by Councilor Todd. Is there any discussion? Councilor Pierce.
Thank you very much. I could not find anything on the CDC website relative to the age other than the 2 years of age, no one under 2 years. Was I looking in the wrong place? Did someone actually see something of greater than 2?
I think Councilor Rice Hawkins may have an answer for you.
If anybody else has any other information, I take it. I believe the CDC has stated not under the age of 2. I don't know that there's been any other age recommendation. I would be supportive of going down to age 2 if folks were interested in that, but I at a minimum would like age 5 to be consistent with what our children are being expected in other venues of their life.
Follow up, Mr. Mayor?
Please.
My only reservations are we have quoted the CDC throughout this, and I looked very, very hard for an age of 6 or 5 or whatever. So I don't know if we're being arbitrary. So I have a little problem with quoting the CDC and now we're plugging in another number. So tell me I'm just worried about things I don't need to be.
I would never tell you such a thing.
I might.
Councilor Keach.
Thank you, Your Honor. I will abstain from this vote because, quite frankly, I don't have a medical degree, so I'm not sure why, as a council, we're getting involved at a level where we really don't know a lot about this stuff. Policy is one thing, medical decisions is a whole different thing, and I'm just not comfortable diving that deep into it.
Okay, thank you. Councilor Fennessy.
Thank you, Mr. Mayor. Just to speak quickly to this point, this was one of the things that came up with the subcommittee. I believe this was taken from a couple different ordinances that use the age of 10. We spoke briefly about it. Perhaps Councilor Champlin or the mayor remembers more of it than I do, but my general understanding was when we considered this, we thought, maybe the age one way or the other, but from our perspective, it seemed rational that you would have an age at some point where the expectation would be that children would be able to do this and be able to wear a mask reasonably most of the time.
Thank you very much. Councilor Hawkins.
I'll hold for now, thank you.
Okay, Councilor Grady Sexton.
Thank you, Your Honor. We did have this discussion in our subcommittee meetings, and we didn't find anything, and I've not since found anything that dictates from the CDC anything other than a child 2 and under should not be wearing it, or a child who cannot remove the mask on their own. But I do know that on August 24th, the World Health Organization and UNICEF issued a joint statement saying that children 5 and under should not be made to wear masks during the coronavirus pandemic. So just wanted to note that.
Thank you very much. Appreciate that. Councilor Champlin.
Thank you, Your Honor. I think Councilor Fennessy's memory was spot on relative to our discussions. I think the reason that we have the age 10 mark off, a line off there, is because that's what other communities whose ordinances we reviewed had. To me, the most compelling reason to move the age down to 5 and above is the testimony of Dr. Deal, who is a retired pediatrician and who also was a doctor for a school district in another state, who in fact would has testified and has communicated with me, separately, that she would prefer to see it actually at 2 and above. But I think 5, as Councilor Rice Hawkins has indicated, is the age at which our kids are being asked or directed to wear masks in other venues. And so this creates consistency. And I think it creates a line of demarcation that avoids confusion in retail stores and in terms of enforcement. Thank you, Your Honor.
Thank you. Councilor Nyan.
Thank you, Your Honor. I certainly recognize what Councilor Keach said. I'm not a doctor, so I don't know if the 10 is the right age or 5 is the right age, but I would certainly think that if a child is old enough to go to school and potentially be exposed to germs, that we would expect that child to be masked. But it does, tying it back to the enforcement issue, does the city have any ability to even ticket or issue fines to minors?
Well, our city solicitor has his hand up. He was going to be recognized next, so you can field that question along with what else you're going to say.
So relative to enforcement, the ordinance would apply to whoever that this council states that it applies to. And so it would be enforced accordingly, regardless of age. I would note that when we looked at this for the committee, the subcommittee that is, the 10 and under seems to be the prevalent age of other municipal ordinances that those municipalities have adopted. I think there's 7 or 8 of those ordinances out there right now with that age. The state of Maryland exempts children 2 to 9 for face coverings. And so there's not much in the way of guidance here. I would note that for day camps and daycares, the governor doesn't require face coverings for children in those facilities. But that's what we have right now. And certainly the DHHS and the CDC state that children 2 or under should never wear a mask.
Thank you. Councilor Rice Hawkins.
Hey, thank you. I would just note on the age 10 excerpt from some of the other municipalities, some of the municipalities had put their ordinances in early on, like around the April, May, June timeframe. And so I think we've had more information and guidance since then. So I would just caution us about following, what is seemingly an arbitrary age at that point for some of those municipalities, and also with school starting back up. As I mentioned, having some consistency with the school district, and then also, like I know the Boys and Girls Club of Central New Hampshire, for example, sent a statement out about 2 weeks ago now saying that they're going to have school-age children wear masks in the childcare facility as well, also to remain consistent with the school districts and to help those kids get in the habit and practice of doing that. Thank you.
Thank you. Okay, are we ready for the questions? So again, the motion is on number 5. It strikes the word number 10 and replaces it with 5 years of age. Any further before we? No. Madam Clerk, if you can call the roll, please.
Councillor Bouchard.
Yes.
Mayor Boulay.
No.
Councillor Champlin.
Yes.
Councillor Fennessy.
No.
Councillor Grady Sexton.
No.
Councillor Hatfield.
Yes.
Councillor Keach.
No.
Councillor Kennison.
Yes.
Councillor Kretovic.
No.
Councillor Mattson.
No.
Councillor Nyan.
Yes.
Councillor Pierce.
No.
Councillor Rice Hawkins.
Yes.
Councillor Todd.
Yes.
Councillor Werner.
Yes.
So 8-7. So it passes 8-7.
Motion is adopted 8-7. Okay, we have a supplemental ordinance pending before us. We have the one amendment that was adopted in Section 5. Is there any further discussion on the amendment before us as a whole? Councilor Nye?
No, I am supportive of the amendment. I was going to make another amendment, Your Honor.
Okay, be recognized for an amendment.
Recognizing that the enforcement issue is very challenging, and we had talked about the fine and whether or not it was appropriate. I think if we're going to actually have an ordinance with a fine provision, that the fine at $15 is not significant enough to discourage, non-compliance. So I move that we raise the fine from $15 to $50 for the first violation.
Is there a second?
Second.
We have a motion made and seconded on that. Is there any discussion? I'll just kick it off if you don't mind. So I have been, I've listened attentively to the testimony and to the discussion, and I think that it's been a real healthy discussion. But this I actually have strong opinions about. I guess the question becomes is what are we trying to accomplish here? And I think part of it is we're trying to change behavior for people truly to be respectful of one another. And I think that, if we're trying to get people to change the behavior and we're educating people, I would say this, I am not interested in punishing anyone. I am absolutely not interested in punishing anyone. And I just can't imagine that somebody who's down on their luck, we've talked about the economy, we've talked about helping small business. somebody's lost their job and all of a sudden you're going to come along and whack them with a $50 fine. I just think that's outrageous. I think that we want to change behavior. We want people to be safe and respectful of one another. We do not need to be punishing one another. We don't need to be punishing the person who may be homeless, who on the street who doesn't have a mask. We want to give them a mask, hand them a mask, and encourage them to wear it. We don't want to punish them with a $50 ticket. These things add up fast, and I can speak to my son was in the food services industry. I know how hard they work for their tips. I know how hard they work. You hit them with a $50 fine because somebody makes a mistake like this when it can be corrected by a simple "here's a mask." I don't think we intend to do that. I am not interested in that whatsoever. So with that, I will absolutely be opposed to this. I think it is just horrific that we would be wanting to punish somebody. We want to encourage people, not punish them. With that, I'll recognize Councilor Todd.
Thank you, Your Honor. I think I agree with you just as strongly as you stated it. And the difference that I see, though, is, as we've heard tonight, this is going to be a very difficult ordinance to enforce, first of all. It doesn't seem as though we're going to really have adequate staffing to provide a widespread enforcement. We heard the police chief basically say he's not going to be patrolling up and down the street, nor will any of the other officers, and devoted strictly to enforcing this ordinance. And I think that coupled with the fact that we kind of understand that the police already have within their discretion whether or not to issue a warning on any ordinance that is out there on the books, makes me support the notion of, as I mentioned earlier, the deterrence factor, that you're sending a message that we're taking this seriously. And that's really the only reason that I'm supportive of something that would be a higher fine. If I thought for 1 minute that this was something that we were going to be out there on Monday morning and there was going to be 50 officers patrolling and handing out tickets, I think I would be with Your Honor on this. Thank you.
Thank you. Councilor Knight.
Yeah, thank you, Ron. I actually appreciate the comments you made because, frankly, I was kind of hoping would go in that direction. So I don't think we should have any fine whatsoever. The whole idea that we talked about was trying to encourage proper behavior, and if we're not going to fine someone $50, I don't think we should be fining them $15 either, especially in light of the enforcement component.
Thank you, Councilor Keach.
Thank you, Your Honor. This goes back to my original question, which was rhetorical in the beginning. Is this about enforcement or education? And in my mind, it's about education. And so, yeah, I'm not in favor of hammering people over the head with this, but encouraging them to do the right thing is my goal.
Thank you. Councilor Warren.
Thank you, Your Honor. I also would be opposed to raising the fine from $15 to $50. You know, I think that the very fact that we have this ordinance, or hopefully we'll have this ordinance, sends its own message, is educational, but also fines do have an educational component. Somebody gets a fine because they did something, they'll think twice about it. But I don't think it needs to be at $50. I think the educational component of a fine at $15 is appropriate.
Councilor Crederick, please.
Thank you, Your Honor. I appreciate your comments, Your Honor, and the anxiety that I heard in your voice, because I, again, have already said that this is already making me cranky. But Councilor Nye and I appreciate your comments as well, especially for the fact that not charging for $50 on this fine and scaling that back is important as well. I do think that if we were to be so enforceable in this community, that we're going to undo all of our community policing efforts that we've put in place for the last 10, 12 years. I think the education of our community is far more important at this stage, and this is something that can always come back and be revisited if we really feel like this is not making an impact. So I'm going to support the effort as it stands with the $15 fine and our education efforts first. Thanks.
Thank you. I have no other hands raised. Are we ready for the question? Madam Clerk, if you call the roll, please.
Councillor Bouchard.
Is this on the $50 fine?
Yes.
No.
Mayor Boulay,
No.
Councillor Champlin,
No.
Councillor Fennessy,
No.
Councillor Grady Sexton,
No.
Councillor Hatfield,
No.
Councillor Keach,
No.
Councillor Kennison,
No.
Councillor Kretovic,
No.
Councillor Mattson,
No.
Councillor Nyan,
No.
Councillor Pierce,
No.
Councillor Rice Hopkins,
No.
Councillor Todd,
No.
and Councillor Werner.
No.
And the motion fails. So we are back to the original motion as to adopt this supplemental ordinance as amended by section 5. Any further discussion? Seeing none, are we all ready for the vote? Madam Clerk, if you can call the roll, please.
Councillor Bouchard,
Yes.
Mayor Boulay,
Yes.
Councillor Champlin,
Yes.
Councillor Fennessy,
Yes.
Councillor Grady Sexton,
Yes.
Councillor Hatfield,
Yes.
Councillor Keach,
Yes.
Councillor Kennison,
Yes.
Councillor Kretovic,
Yes.
Councillor Mattson,
Yes.
Councillor Nyan,
No.
Councillor Pierce,
Yes.
Councillor Rice Hopkins,
Yes.
Councillor Todd,
Yes.
and Councillor Werner.
Yes.
With a vote of 14-1, the motion is adopted. Okay, that takes us to comments and finishes with our action phase, that is. Takes us to our comments requests by mayors, city councilors, or city manager. Anyone have anything they want to share? Anyone? Good answer. Thank you very much. Could I have a motion to suspend the rules to take up items suspense 1 and suspense 2, please?
So moved.
Motion made and seconded to take up, suspend the rules to be allowed to take up suspense 1 and 2. Madam Clerk, if you call the roll, please.
Councillor Bouchard,
Yes.
Mayor Boulay,
Yes.
Councillor Champlin,
Yes.
Councillor Fennessy,
Yes.
Councillor Grady Sexton,
Yes.
Councillor Hatfield,
Yes.
Councillor Keach,
Yes.
Councillor Kennison,
Yes.
Councillor Kretovic,
Yes.
Councillor Mattson,
Yes.
Councillor Nyan,
Yes.
Councillor Pierce,
Yes.
Councillor Rice Hopkins,
Yes.
Councillor Todd,
Yes.
and Councillor Werner.
Yes.
Thank you very much. We have before us item suspense 1, which is a report from Deputy City Manager, Development recommending City Council confirm the appointment of an ad hoc committee to oversee the redevelopment assessment for the former gas holder house. Councilors Champlin, Kennison, Kretovic, Todd, and Warner make up the committee. Is there a motion to approve the appointment of the committee?
So moved.
Second.
Motion made and seconded to approve the establishment of the ad hoc committee. And we'll also note that Councilor Champlin is the chair of that committee. With that, is there any discussion? Seeing none, Madam Clerk, if you can call the roll, please.
Councillor Bouchard,
Yes.
Mayor Boulay,
Yes.
Councillor Champlin,
Yes.
Councillor Fennessy,
Yes.
Councillor Grady Sexton,
Yes.
Councillor Hatfield,
Yes.
Councillor Keach,
Yes.
Councillor Kennison,
Yes.
Councillor Kretovic,
Yes.
Councillor Mattson,
Yes.
Councillor Nyan,
Yes.
Councillor Pierce,
Yes.
Councillor Rice Hopkins,
Yes.
Councillor Todd,
Yes.
and Councillor Werner.
Yes.
Motion's adopted. We have before us item suspense 2, which is an item to be set down for the September 14, 2020 public hearing. It is a resolution appropriating the sum of $20,000 to fund the assessment of redevelopment scenarios for the former gas holder house, authorizing the use of $15,500 from the Economic Development Reserve, and is a transfer in and accepting the sum of $4,500 as a donation from the New Hampshire Preservation Alliance. Together, we've also have a report from the Deputy City Manager for Development. Can I have a motion to have this item set for a public hearing on September 14th?
So moved.
Thank you very much. Motion's been made and seconded. Is there any discussion? Seeing none, Madam Clerk, if you call the roll, please.
Councillor Bouchard,
Yes.
Mayor Boulay,
Yes.
Councillor Champlin,
Yes.
Councillor Fennessy,
Yes.
Councillor Grady Sexton,
Yes.
Councillor Hatfield,
Yes.
Councillor Keach,
Yes.
Councillor Kennison,
Yes.
Councillor Kretovic,
Yes.
Councillor Mattson,
Yes.
Councillor Nyhan,
Yes.
Councillor Pierce,
Yes.
Councillor Rice Hawkins, excuse me,
Yes.
Councillor Todd,
Yes.
and Councillor Werner.
Yes.
The motion's adopted. Before I accept the motion to adjourn, I just wanted to add two quick things. First, number one is I just want to say thank you to you all and to the committee and the time and effort, as well as our legal department. There was a lot of effort that went into this. I really appreciate the extremely thoughtful conversation we had this evening. And quite frankly, I thought we had some really thoughtful and outstanding testimony as well. So thank you all, and thank you for those who participated. This has not been an easy thing to deal with, but I think we're all looking to do the best interest of the city, and I think we've accomplished that. So thank you so much. Number two is, before we go, this is the last meeting before we have our state primary in approximately 1 week, because it's almost midnight here. And I wanted to give our city clerk the opportunity to have any last minute requests or comments regarding the primary election before we sign off. Madam Clerk, do you have any comments?
Just a couple. Remind everybody that we are not going to be using Havenwood this year for our Ward 9 residents. They should go to the Citywide Community Center. Second thing is the city clerk's office. Although Monday is a holiday, we will be open regular business hours to assist residents that wish to either return their absentee ballots to our office on Monday or come in and vote. So we will be here 8 to 5. We have a lot of absentee ballots that have come in, so that's exciting. And I thank in advance all the ward officials for helping us out, all of you for helping us get volunteers, and the staff here for doing such a great job.
Thank you. Well said. One last chance. Anybody have anything before we go? Okay, seeing none. Councilor Grady Sexton moves we adjourn, seconded by Councilor Hatfield. Madam Clerk, if you call the roll, please.
Councillor Bouchard,
Yes.
Mayor Boulay,
Yes.
Councillor Champlin,
Yes.
Councillor Fennessy,
We.
Councillor Grady Sexton,
Yes.
Councillor Hatfield,
Yes.
Councillor Keach,
Big yes.
Councillor Kennison,
Yes.
Councillor Kretovic,
Yes.
Councillor Mattson,
Yes.
Councillor Nyhan,
Yes.
Councillor Pierce,
Yes.
Councillor Rice Hawkins,
Yes.
Councillor Todd,
Yes.
and Councillor Werner.
Yes.
Great. Thank you, everyone. Have a safe week, and we'll see you all at the polls.
Thank you. Good to see you all.
Bye-bye, everyone.
Bye.
Great pleasure.